know if we're live or not. Perhaps I'll get a notification.
Let me check on YouTube.
We can just assume we're live.
Oh,
We're good. We're good.
I got a thing. Okay, so Mike, I'll take your word for it. Here we go.
You know what time it is. Buckle up and enjoy the ride.
And we are live. Greetings to our loyal WFYL listeners around the world. Welcome back to your Philadelphia live stream, only on the Freedom Station. I want to thank each and every one of you for tuning in once again, because you still have the right to hear and the right to be heard. Ladies and gentlemen, my name is Mike G. As always, with me are Philly Chris, Russ the producer, and Liberty Lee. And you're listening to Mike G in the Morning with The Law Matters. And you can listen to our program every Friday at 7 a.m. Eastern, only on the Freedom Station, WFYL. So let's be heard. I want to remind our listeners that you can participate in the free and open exchange of thoughts and ideas throughout the entire week by visiting MikeGinTheMorning.com. Philly Chris?
MikeGinTheMorning.com.
Liberty, you there?
MikeGinTheMorning.com.
So tell your friends, tell your family, tell your barber, tell your Uncle Jerry, tell anybody who listen to check us out at MikeGinTheMorning.com. I also want to remind our listeners about the powerhouse lineup we've got here at the Freedom Station. We've got Ben Shapiro bringing you the Ben Shapiro Show weekdays at 3 p.m. Scott Adams coming at you with the Scott Adams Show weekdays from 9 a.m. until noon. We got the very special one and only Dan Bongino coming at you with the Dan Bongino Show weekdays from noon right until Ben Shapiro. And finally, we want to welcome him to the Freedom Station family. We got Michael Knowles bringing you the Michael Knowles Show weekdays at 5 p.m. So don't forget to tune in and show him some love. I also want to remind our listeners that today's episode of the Mike G in the Morning program is brought to you by Elite Tactical Armory at EliteTacticalArmory.com, your firearm storage solution in the Lehigh Valley. Do you know what a commercial armory is? Well, you should. Recently, the Pennsylvania government has acknowledged commercial armories as an acceptable mechanism for off-site storage solutions. Whether you've got a kid who's on probation, maybe you're leaving town for a little while, or maybe you just run out of room for all your precious babies, Elite Tactical Armory is the off-site firearm storage solution for you. You can check them out at PACommercialarmory.com or EliteTacticalArmory.com. Our very good friend, David Coates, I believe we're going to be doing an episode at their location pretty soon, Philly Chris. What do you think about that?
I'm excited about it. I'm looking forward to it.
We got to get attorney Richard Roberts come on out there. He's also from the Lehigh Valley. We'll get over to EliteTacticalArmory.com. So check him out, Elite Tactical Armory and PACommercialarmory.com, because it's important to support those who support freedom. And be sure and tell them Mike G sent you. And with that, you know what time it is. Buckle up and enjoy the ride. Hit it, Russ.
You know what time it is. Buckle up and enjoy the ride.
For those of us just tuning in, you're listening to Mike G in the Morning with The Law Matters, only on the Freedom Station, WFYL. We've got a very special guest joining us for the program today. You know, recently I have noticed how many brave children there are out there who are persevering through various illnesses and various conditions, and just how strong they have to be to do so. We've got a guest today who is right in the middle of all this fighting to help these children. and helping raise awareness, doing great things. We've got Monica Weldon. She's the president and CEO of the SYNGAP One Foundation. Monica, are you with us?
I am. Thank you so much for having me. I'm really excited that you asked me to be on the show today. I'm really excited.
Well, it is our pleasure. We are glad to have you. We've heard about some of the great things that you've been doing, and we decided it'd be a great idea to have you on the program so the Mike G in the Morning family can hear about what it is that you do. So I wanna hear, first of all, if you could tell us in a couple of sentences about what you do. We'll start with that, but I want our listeners to really get to know you. So we'll jump around a little bit. Why don't you tell us a little bit about your position right now and the 1,000-foot view of what it entails?
Sure. Well, I am the president, CEO, and founder of the first organization in the world to drive medical research for a SYNGAP1 mutation. My son was the 6th one in the world diagnosed with this particular condition in 2012. Wow. And it has brought me to this point today where it's now one of the top single gene mutations linked to autism. And I have found myself, I guess, at the age of 52 in law school, earning my master's of science law so that I can help change some of the barriers to access to healthcare treatments, incentivizing pharmaceutical companies to take on rare diseases. I would have to say I'm an activist and I'm an advocate, and a mom of 5. I can't forget.
Wow.
5 children. My oldest 3 are adults, and my twins are 13, and they are boy girl. And my daughter Piper is 13, and my son with the genetic mutation is named Beckett, and that's her twin. So that's kind of me. And I'm from Houston, Texas, and I commute back and forth between here and Washington, D.C.
Wow, that is incredible. That is incredible. So you're in Houston now?
I am in Houston now. I just got back from DC on Friday.
Okay. Okay. So really all over the place.
Yes.
Now, going to law school during all of this, you've already got so much on your plate dealing with the SYNGAP One Foundation. Some might say you're a little nuts. What would you say to that?
Yes, absolutely. My board chair said, "You're doing what?"
They said you're nuts. Don't mince words here. That's what they said.
Because he's an attorney,
so he knows exactly.
Yeah, and he told me, I don't know how you're doing it, and I said, well, you just do. I guess when you have a passion about doing, what really, this is a calling for me.
Right.
This was and I'm just going to throw it out there. This is a God calling for me, and I have a passion for it. I love what I do. I taught school for 23 years before this, and science, in fact, and I got kind of thrown into a whole new midlife crisis. I guess you'd call it. So, but I love law school, and I'm at Northwestern, and I started my 2nd year actually this week, and part-time, of course, but I guess the concentration that I'm focusing on is healthcare legislation, both at the federal and state level, and regulations. So
you said that you love law school, Monica.
I do.
You seem to be many things, Monica. You seem to be perseverant, brave, strong, intelligent, and certainly nuts. We're not going to leave off nuts out of there.
Okay, yes. I would have to say I have been called, that crazy.
That's been a couple years if she still enjoys it.
And rightfully so. I want to kind of get a sense of your story. I want our listeners to get to know you. So did you grow up in Houston, Texas? Are you from there originally?
I am a born and raised Texan. Yes. Wow. Yes, I am.
No reason to leave when you're from God's country out there, right?
Well, that's what they say. I mean, they have said, we could be our own nation. However, I don't know how well that would fly with the rest of the United States.
I'm sure a lot of people would move there if that were the case. They'd
I'm
say,
thinking
"You know
about
what,
it.
if we could be
People are
guaranteed."
moving here. They are moving here.
They
anyway.
are, but I think the issue is some people who are moving there, moving from places where their politicians have destroyed the land, places like California, and
yeah.
they've voted for these policies that destroyed their state. And then they say, we've got to get out of here because it's so bad now. And then they go to Texas and they vote for the same policies and the same kinds of politicians.
We have seen that. Yes, yes.
Yeah. I think that the expression is "Don't California my Texas," right?
That's right.
That is what they say. Yes, and yeah, in fact, we've got a boom in the housing market here, and people are selling. And I think on my street alone, I think 5 people from California and New York have moved in.
Wow.
And so, I mean, they're great neighbors. Don't get me wrong. I mean, I don't ask. I just, say, hey, I'm a crazy neighbor. You're gonna have to put up with me.
As long as they're New Yorkers like myself who came to a freedom state to escape and understand why the state was ruined in the first place. So, Monica, growing up in Houston, Texas, what was it like? What was life like?
Oh my gosh, it's hot. It's definitely hot. I've learned how to live through hurricanes. I've been through several. We have the one of the world's largest rodeos, and I did volunteer for the Houston Livestock Show and Rodeo for close to 7 years. And so, yeah, okay, but everybody has this. I guess this thing that we all wear just cowboy hats and boots, right? And have horses, No, I only wear my cowboy boots and my hat to the rodeo, or boot scooting, right? I go boot scooting and go line dancing every now and then. And so, I mean, I love it here. It's definitely a different culture. I also, I kind of caught marble fever. I love Washington, D.C. It's just a different culture, and you can transition from one. I don't know. I have the best of both worlds, I guess. It's I know it's just different in DC, but it's different here. People are friendly. Neighborly, and we have the best barbecue in the world. I'm just saying. So.
Sure, absolutely. And you say not everybody wears cowboy boots and cowboy hats. I went to undergrad in Oklahoma and law school in Oklahoma, so we would swing on down to Billy Bob's in Fort Worth. I don't know if you've ever been there.
Yes.
So my first exposure to Texas is over in Billy Bob's, and literally everybody's got cowboy hats and cowboy boots on.
Okay.
So it is exactly the way we pictured it.
No, yeah, it's I mean, we have all different kinds of a variety of different things here. People think we're just cowboy hats and we're oil country. We're definitely oil country. My dad worked in the oil industry, and not to plug any specific oil company, but he worked for Shell Oil for 35 years. And so, yes, I'm very familiar with the oil industry and that realm as well.
So growing up, what was his job like in the oil and gas industry? Because being in Tulsa Law, a lot of the students who left Tulsa Law maybe didn't even go on to practice law, got involved in the oil and gas industry as a landman. A lot of folks ended up doing stuff like that. So what was his role in the oil and gas industry?
Well, in fact, it's funny that you ask that. My dad was actually part of the history of the oil boom in the 80s. He was one of the representatives that went to Congress and presented at the hearing to get the LOOP, the Louisiana Offshore Oil Platform, approved. And he designed the safety features on that particular platform and convinced Congress. Actually, Joe Biden, in fact, was one of the junior representatives he testified in front of. And he and all of the oil CEOs were there. And from him going from the refinery all the way to being a vice president, working in the environmental regulatory space of the oil companies, put he's the one who negotiated between permits between the federal, state, and the local governments, trying to create different incentives to get to drill. Like if they would go drill, they would then create a park after, and making the land better than it was. So that was his job. So I learned a lot. I did. That's what I started out doing after college. My undergrad is in biology, and went into working in the environmental research realm of testing oil cores. That was fun.
Wow. I don't think people realize how the oil and gas industry relates to just about everything. They only think vehicles. And it goes to so much more than that, right? If you're looking at petroleum, for example, I mean, what's everything, right?
Right. And I know, I can't believe I actually know what a cat cracker is. You know what a cat cracker is?
I do not. I'm one of those escaped Yankees who went to school down there and never got into the oil and gas.
Okay, so a cat cracker, you can pick it out in any refinery. It's like a big tube. It's all the way up in the sky. And what it does is it's got pipes in it at different levels. And so when they go to refine the oil, they boil it, right? And so when you raise the temperature, it will divide up in its densities and in its parts. So you have tar at the bottom, and as you keep going higher, it's like a density tube in science, right? Mm-hmm. So you have tar, you've got petroleum, you've got ethanol, all of these different fuels that come from petroleum, of course. It's raw crude oil. And so my dad taught me about that. I heard about it at the dinner table.
The cat cracker. I was thinking it was one of those things that came in the red box with the string on it, but then I realized that's animal crackers, right? That's not a cat cracker. That's an animal cracker.
I'm thinking, okay, yes.
I'm buying one on eBay right now so I can make my own gas.
Hey, man,
You've got any crude oil? You got a cat cracker? Then you can set up your own nice little refinery, and then we called the big what do you call it? The storage tanks, the huge storage tanks you hear. Well, those are the BRTs, the big round things. That's what we
big
call
round things. Yeah, the BRTs.
The BRTs. So we call them the big round things, and that's what they stored all the oil in after it was refined. And then they distribute it. Now I don't live in Pasadena anymore, which is called. Now this is no disrespect to Pasadena because I was born in Pasadena, but they called it Stinkadena after a while. And so my parents moved to northwest side of Houston to get away from the sulfur smell.
Gotcha. So now, what did mom do growing up?
My mom, well, she was a teacher for 1 year. And then when my dad my dad was in the Navy for 13 years. Wow. And so she was the wife of a sailor, and she was a stay-at-home mom after about a year of teaching. And I have an older brother, and after my older brother, she actually I had two sisters that were stillborn, and then I was the oldest girl. So there's 6 years difference, and then I have two younger sisters. So we were a big family. I guess that's why I ended up having, I don't know, big family. I have 5 kids. And people ask me, what were you thinking? But then I went into teaching school.
And so you folks are pretty close growing up.
Yeah, they're still around. They my dad, after he retired, went from the suit, going back and forth downtown, commuting downtown every day for 35 years, and decided to go buy him a 300-acre ranch and put cows on it. So now he wears overalls.
Wow.
And I've never, I guess when he retired, it's kind of like who cares what anybody thinks of you? Because now he looks like Santa Claus and he's grown his hair. And I'm like, Dad, are you gonna cut your hair? Because he just kind of took over. So he plays Santa at Christmas.
That's cool.
And you know,
You
and
would
my
think
mom-
that's cool, Philly Chris. Look
That's
at you
right.
over there. I haven't shaved in 2
We
months.
talked about that last week. I'm working on that for this holiday
Yeah.
season. We'll see what happens.
Chris and your dad are in
Yay.
cahoots, I think. They're calling each other. So what are we doing next, guys?
Oh my! So anyway, no, I froze there for a second. I didn't catch your last. So you're gonna go with Santa then, Chris?
Yeah,
right?
yeah. I'm working on it.
Yeah.
Turned gray in the past few years here.
So, but yeah, I have a very eclectic life. And it's brought me to here, and I am working on a second book. I published a short book of my son's journey called My Special Boy, Slow Moving Stream. And I've had many different experiences, and I just want to kind of wrap that up and take where I am now to try to encourage others within the space that I am, or even outside the space, because I do public speaking as well.
Sure.
From all the lessons that I've experienced, because of course, like everybody's life, it's not always roses, right? So
Right. Absolutely. Now, to the point that we've gotten up to so far, sounds like something out of a movie. You got dad who's in the oil and gas industry. He's very successful. You've
Mhm.
got mom who, is concentrating on the family, right? Just another thing from that all-American movie type thing. And you've got how many siblings in total? You've got older
I have
brother and
older brother and 2 younger sisters.
okay, so there's the
4
four of
living.
you,
That
and
4th is me. Yes.
and everybody's happy and
Well, yeah. Well, I would have to say it's an experience to sit down with us at the dinner table, especially coming over for the holidays. There's always, I don't know, and I think it's rolled off on my children. And I don't mean to be like, I'm very sarcastic, and I think I had to use sarcasm just to cope sometimes.
Well, you're on the right show then. That's good.
But there would always be somebody and I have to say, I grew up Southern Baptist. My dad is a Baptist deacon. And it definitely was an experience, and now he's just like, and we came from like very strict background, and now it's like they've totally chilled out, as in their older age. And so it was very interesting at holiday dinners. Yeah, I could have a lifetime, not movie, but I could make my life probably into a series. And I actually, I actually thought, okay, I'm going to get a GoPro. And I was like, do I want to get a GoPro? No, I don't want to get a GoPro. Wear it around. It would be really entertaining, but
Just film the reality show.
Yeah, why not?
oh yeah, it would. There's never a dull moment ever. There's
So
always something.
So when you're in high school, are you thinking ahead towards anything that you want to do, where you want to go in life or anything like that?
Oh man, high school. I will tell you that this is one of the reasons why I'm writing my second book, is because if I guess rewind back to 3rd grade in elementary school. My reading teachers actually told my parents. Now let me preface with this, is that my parents never ever told me what my teachers expected me to do, right? They never let on that someone doubted my potential. And in a 3rd grade, I struggled with reading, I struggled spelling, comprehension, all of these different things. And of course that was okay. And I think I gave away my age already. So this was in the 70s, right?
I remember the 70s.
So I was born in 1969. And so, and there wasn't much in the way of helping kids that had learning disabilities. So my parents really really were the drivers behind me. And I have to say, my dad was a hard, I don't know if I can say that or not, but he was a hard donkey. I don't know
Mm.
and not say on the radio, but
There we
he
go.
was. He expected a lot because his upbringing. I mean, he was poor, and he pretty much lied about his age to get in the Navy just so he could get a job to get out of the house. And he worked his way up. He was a hard worker, and we were taught you don't work, you don't eat. But back in third grade, they tested me, and I wasn't doing well. I just could not get it together. Now my brother and my sisters were like straight A students. Everything came very easy for them, which I'm glad. They didn't have the same struggles as I did in learning. But they told my parents that I was mentally now. Please understand that when I use this term, this is the term they used back then. And so I don't want to offend anybody by using this, but this is what they told my parents. They told me that I was mentally retarded. And of course, now we don't refer to that phrase anymore. We refer to intellectual disability as a more less negative connotation to it, right? So moving forward, I was always put in reading class. I had to give up my elective. And part of my experience was I always had to look through this glass window, and I was in the reading class because it was open concept back then, right?
Mhm.
And people could look in, and I just remember people walking by going, "Oh my gosh, she's in a special class. She's in a special class," and you kind of wear that as your self-esteem is really just beat up,
Sure.
and you couldn't participate in a lot of things because you had to give up. I had to give up my art class, which I love art, to take
Wait,
reading.
really? They make
Yeah,
you substitute it out? That doesn't seem to
they
make
did
sense.
Yeah.
then. Yes. And
All
I
right.
think back then they only had like 6 or 7 classes. Now they're up to 8.
Well,
But
if your strong suit isn't something else that they deem to be important, you could
mhm,
be missing out on maybe you're the greatest artist in the school, right?
right, exactly. So I mean, that's why, even coming from the teaching field, not everybody's made for college. I mean,
Right.
and you don't have to be a college PhD to make a difference in this world, as long as you are teachable and you are willing to put the work in to it.
Sure.
And you can do anything in the world. You know, but as I, kind of went, and I tell you what, middle school was, it was horrible. And high school was even more horrible. And I could never get a date in high school. I had to ask my prom date. I was like, oh my God, I get Well, I think that's because my dad used to chase them away because I would have guys
That's a
come
good
over.
dad.
That's
That's
right.
my
That's
kind of
right.
dad.
That was his job. Yeah.
He would have them, he'd have them every time either go outside and split wood or bring firewood in just to give them a chore to see how they were going to work.
That's good.
And he would whisper in their ear. I did have one guy have the courage enough to tell me at lunch one day, you know what your dad told me when he took me out? I said, what did he say? He goes, if you ever touch my daughter and you hurt my daughter, I'm going to rip your arm off and beat you with the bloody end of it.
Ah, not bad. Not
So
bad.
that was my dad.
We,
But
we would say it a
I
little bit differently in Brooklyn, but similar in substance.
he did. And so that is I had a very protective dad, and he grilled him, and I just never dated, and I never could. I don't know what happened, but but in 10th grade, I guess back to my education, uh this is when they finally tested me, when the diagnostic tests came in, and like say dyslexia, right, and special ed were becoming more prevalent in the schools to getting services, where you had the ADA laws, right, come in to not discriminate, and you want least restrictive environment for a student, but you also want to help accommodate their learning needs.
Mhm.
So my mother demanded testing. She went all the way to the school board, and um, after the counselor said, you know, she's got learning disabilities, and this, and this. She can't spell. She can't comprehend. She can't pronounce words. she reads backwards. She, skips. Well, I ended up having, I was a slight, I was a mild dyslexic. I probably have something else, like what they call, I've always wondered if I had scotopia, and not a lot of people have heard of that, but it's where
No.
depending on the color of the paper that you're looking at, the words jump around on the paper and you can't really track.
Really?
So yeah.
So did you ever figure that out? Are there certain colors of paper that work better than others for you?
There are. And when I was a teacher, there's the color cyan, you have yellow, and then you have magenta. And so those are all your three basic colors, right? So you have cones, you have rods and cones in your eyes. So it depends on how your eyes will pick up the color. And if you have an overlay over a white piece of paper, then for some reason, the way your brain processes the letters, you can read better. So you can concentrate. And then also, if you haven't noticed already, I'm ADHD.
So
are
no,
we.
not at all. So what colors of the paper work best?
I think that for me, blue works best.
Oh,
I don't know why, but white paper, it seems bright. And letters jump. So when I can, I like to have either a blue light, on the paper when I can read, because as you know, in law school, that's what you always do.
Right.
Back in 10th grade, they didn't know that. But on the side, my parents were asked, basically pushing to get services and help for me in the 10th grade, because I was a C student. I was an average student in high school and all through. And they told my parents, don't send her to college. You're just setting her up for failure. She's already depressed. She already has a low self-esteem, struggling. And don't get me wrong when I say this either. I love hairdressers. I need my hairdresser. I've had my same hairdresser for 14 years. And I told her, if I ever move to DC, I'm moving. I will commute back to Houston just so she can do my hair. And so don't get me wrong, because that's just not a passion I had. But the counselors at my high school told my parents this and suggested they send me to trade school to do cosmetology or be a hairdresser. Well, that's not something I wanted to do. Now, keep in mind, they never told me this. And my dad, and I went visiting colleges, and he asked me, well, what do you want to major in? I said, well, I would like to be a doctor. I love medicine. I love science. There's something that gravitates, that I gravitate to towards that. And he kind of looked at me and he goes, are you sure? And I said, well, yeah. And so we went and looked at the programs, and I chose biology. And he goes, okay, well, you just do the best you can. So I went to a small school called East Texas Baptist University up in Marshall, Texas. And at the time, there was like maybe 60,000 people around. I graduated from high school in '87. And so the classes were smaller. I think at the time there were only 700 students on campus. It was a private school like Baylor, and the cost was like Baylor. And so my dad was like on me to finish my classes and do my work. But he had faith in me, and he encouraged me to do that. And I went through college. I never dropped a class ever. And I never failed a class. Now, I did get a D in chemistry, but I didn't fail.
That's a tough one. Yeah, that's a tough one.
And my heaviest load I took, which they thought I was crazy, I took 18 hours, and one of my classes was histology. And a lot of people don't know what histology is, but it's a study of tissues. And my final exam was identifying 250 35 millimeter or millimeters, the Kodak round canisters with the slides in it. Remember the old fashioned?
Yeah, I remember
like
those.
you had
Yeah.
a projector.
I still have.
I had to
somewhere,
identify 250 slides. There's 35 millimeter slides.
Oh wow.
So
That
in
was
your
my
opinion,
final
which is superior? Is it Kleenex? Is it Scott's? Or
I I like Kleenex with the lotion.
Am I thinking of the wrong kinds of tissues?
So, but I
They had more
did.
brands back then, Mike. Yeah.
Oh yeah, that's. I don't know. Now since I had 5 kids, I just buy generic. I just
Right.
buy store-bought
Right.
brand.
Go to
But
Costco or
whatever works.
yeah.
But when I finished my biology degree in 3.5 years. I had one class to take, and then I decided to try to go into education. So I started taking my methods classes until graduation, because I had finished in December. And in June of 1991, June 1st of 1991, I graduated with a degree, a Bachelor of Science with biology. After I walked across the stage and after the graduation, my parents took me to lunch, and I'll never forget this day. And they sat across the table from me and said, Monica, we are so proud of you. We want to tell you what you did to prove everybody wrong, and you didn't even know you were doing it.
Wow.
Awesome.
And that's when they told me everything, and I couldn't believe it. And that was a pivotal point in my life that I realized I wasn't stupid. I was not incapable of being better. And that's when I realized no one was ever going to label me again. No one was ever going to put a ceiling on me of expectations. And of course, I ended up I guess after graduation, I actually ended up having my daughter out of wedlock. And of course, you don't do that. And I tell you what, she's amazing. She's 29 years old and she's a United flight attendant, and probably her name's Haley, and amazing. She changed my life as well with that experience. And because, coming from the South and coming from a Christian background, and not knocking anything, I think you feel like you just aren't worthy, right? I mean, and that's I don't know.
Sure.
I don't know. Does that make sense? And not to sound judgmental, but there are people that are judgmental. And but that experience taught me that I needed to fight for my child then. And then I ended up having 2 sons from my first marriage. We were married 7 years, and because we were married very young. And then I ended up, I guess 4 years later, I got remarried, and we decided after 6 years of marriage, because he did not have any children, we would try to have babies. But the thing is because I got pregnant so easy. My first marriage, I had my tubes tied at 28, because it's like every time I looked
No.
looked at a baby, I was pregnant. I was like, how did that happen? You don't
Right,
understand.
right.
I don't know. But anyway, Myrtle Myrtle, and had three like bam, bam, bam. And I was like, I can't keep doing this. And then I did it again through IVF at the age of 39.
Well,
It was a one-shot deal.
Mhm.
And looking back, through those trials and through just how life shapes you, right? You can either take it and be a victim of it. You can doubt, say, woe is me. I can't do anything, and I was always told can't never did anything. So if I didn't want to be a can't. I want to be I can.
Can't never do anything. I like that. That's good.
And my daughter told me the other night, because me and my daughter have my oldest daughter, well, and my youngest daughter as well. I have a girl on either side of the boys. I told my oldest daughter, I was kind of struggling with some stuff, and she goes, Mom, she goes, nothing is impossible, because obviously, and this is that meme probably everybody sees, is that the word possible is even in impossible. I'm possible. It is possible.
Mhm.
And I really try to change my, I guess, your thought processes. If you don't change your self-talk, then you're not going to change. And and so that's kind of what I've learned. And then it
We're trying to work
became
on that with Russ.
yeah, I guess that's where the sarcasm comes, because I'm
Right.
very sarcastic.
That's good.
I try to behave most of the time, but I have a serious side, and then I have a like what the heck, you know, kind of side of me, I guess. And it's almost like I've been teased, like, dang, your personality's coming out. And actually, I have been to counseling, and asked my shrink the other day, do you have multiple personalities? He goes, no, I don't think you're multiple personality. He goes, I just think you've been through a lot of crap. And it's made you into the person you are, and you're not like, you're a fighter. And that's what I am. And I've learned to fight. And then my special needs son was born. My twins were born. And that's kind of that was what changed my life. At 45, when I got the diagnosis of my son being the sixth one in the world, there was nothing.
Yes.
There was absolutely nothing. And I this time it wasn't me depending on me. It was him depending on me to do something for him. And so I don't know.
So at that point,
bet
you
I
had
used up
been
all your
a
skills.
teacher for how long at that point?
I had been a teacher for 23 years, and I started teaching in 1995, 95, 94. I can't even remember. I stopped teaching in fall 2016. So I started teaching in 94, 95, something like that.
So
I
you've
find
been
it
a
really
teacher, and you had 3 other kids of your own at that point. Well, if you count
Mhm.
the twin 4
Mhm.
other kids of your own, and you have this child who ultimately gets this diagnosis.
Mhm.
What was it like when he was growing up? Did you notice anything? What are the signs that you noticed, and that maybe other people can sort of look out for? I know it's very rare, but nonetheless, if you would have noticed all these things and somebody said to you, "Well, that's so rare, there's no way possible," then you wouldn't have had him properly diagnosed. Is that correct?
Right, exactly. Yeah, it's I knew, having my 3 before, and raising, children from newborn up. I knew that, when I had the twins. So when I saw his sister meeting a milestone, and I knew that he was supposed to be meeting it, I noticed about 4 months that he couldn't sit up. He was like a limp noodle. So it's what they call hypotonia. So it's very low muscle tone, and almost hyper mobile. Like it's how people can take their joints and contort them. It's almost like it's similar to that. And if you've ever heard of Ehlers-Danlos, it's similar to what people that suffer from Ehlers-Danlos, dislocated joints, things like that. I mean, they just had very low muscle tone. He didn't walk till he was 22 months, and he didn't walk without a walker.
Wow.
And he ended up getting leg braces at 20 months, I believe. And I remember the very first step he ever took in daycare. And because he just crawled around, he could not walk. But just out of the blue, across, when I went to pick him up, he had pulled himself up on the glass door across the room, and he saw me, and he turned around, and one of the daycare teachers was there close and was about to go grab him because she thought he was going to fall. And then he took a step, and then he took another step.
Awesome.
And then he walked all the way across that floor to me, and all of us were in tears. I just couldn't believe it. And I knew, that's when I knew my boy was a fighter. Mm-hmm. And I couldn't give up for him either. I mean, I had to keep on.
But did you know what was wrong at that point, or did you have other misdiagnoses and things of that nature?
They did do a MRI. They found that he had delayed myelin, but it wasn't anything big, they said. We had gone through 19 specialists. Um, 4 neurologists we ended up seeing after that. I thought he was having seizures at 14 months, but they just told me it was infant startle reflex. I was like, that is not an infant startle reflex. And close to 90% of all the children with this particular gene mutation has epilepsy. 5 out of every 500 that are diagnosed with epileptic encephalopathy have this particular gene mutation. So it's probably not as rare. It's just you have to have genetic testing to detect it. And so that's one of the reasons why I do legislative policy. But low muscle tone was the biggest one. The doctor did give him a diagnosis of mild cerebral palsy. And that's a clinical diagnosis. So I'm thinking, how many people that have cerebral palsy could possibly have a gene mutation similar to this, a variant? Because we even have people on, it's a spectrum. So we have children that can talk, children that can't. My son is not verbal. So, and that he falls within the average range. So he's got about a 18 to 20 month verbal. He knows words, but he just can't get it out. He can't make the words. Sensory processing is another symptom of this condition. Absence seizures. And then the group of German parents that we have in Germany actually discovered a new type of, their research scientists, after we started our organization, found a new type of seizure. So chewing seizures, where you have seizures, these reflex seizures where you squint, that their faces squint, they'll jerk. Some of our kids have what they call drop seizures. It's like they'll be walking along and just drop.
Wow.
And it would be and so the symptoms, it seems like the symptoms are all similar, but the severities of those symptoms are range.
I've been reading about this CRISPR therapy, Monica. Have you seen anything regarding that? Is that something that could potentially help him?
Yes, CRISPR is a new and up and coming technology. Right now, it is being debated actually in the research and the congressional realm because of I was featured in part of an article they put out in Stat Magazine on treating genetic diseases with CRISPR in the embryonic stage. And that's I don't know if y'all had heard in the news about in China, they had done this to try to cure HIV and particular embryos. Individuals that were born ended up worse off than having HIV. So, but CRISPR is used in some areas of medicine. Not in embryos, only scientifically up to a certain point is it here in the United States, because there's a moratorium and they don't let the embryos grow. And that's, of course, controversial as well. But in medicine, when they're actually creating like what they call iPS stem cell lines, and they are creating mutations that they know exist in humans, they can use that to kind of test the neuron that they grow, because this is a central nervous system disorder, and it is really hard. CRISPR is in its infancy, if you will, because they have to figure out how safe it is. Now, for gene therapy, you can alter a gene, put it in a virus, and that's how you get a gene therapy. But of course, you have to go through clinical trials. You have to have the animal models, tested. But it is definitely an option for something. Well, I should say, gene therapy is definitely an option that we are looking at.
It seems fascinating if they can get it to work. Yeah.
Yes, absolutely. And then, of course, that's one of the reasons that I'm in law school, is to learn all the regulations around what is allowed, what's not allowed, and then also laws that haven't caught up to technology yet.
Sure. Yeah, it's a good point.
So, but yeah, so SYNGAP1, I mean, just to give you a little background on SYNGAP1 is actually the most abundant protein and I should say nucleic acid protein, right? It's not like the protein you eat, like when you eat a steak, right? It's so this,
like stinks.
yeah. So this is like the remember the building blocks of DNA. So those little DNA create proteins that make the cells that give the directions to the cells on how to behave and function. So SYNGAP1 is the most abundant protein in the brain, and it controls brain plasticity. And one of the big discoveries that we discovered as an organization was a sensory processing mechanism that this protein is linked to, which links it to autism. And it was an accidental discovery. Dr. Gavin Rumbaugh at Scripps, Florida, and I worked together on this particular mechanism that was found. And it was all based on my son's video, because our kids also feel pain. Now, a lot of kids that have intellectual disability, which is another symptom of SYNGAP1, is the cognitive impairment, they don't feel pain normally. They don't
Really?
respond to pain. Yeah.
Really?
Okay.
And he could touch a hot stove and he would already be burned before he would react to pull his hand away.
Wow.
Wow.
Yeah. And so that's dangerous because pain is
Yeah.
actually a survival
Yeah.
mechanism.
Right,
Right.
it's
You would
important.
think people would think, oh, you can't feel pain. That's great.
Right,
But you
right.
can cut yourself and not know
Yeah.
about it. You can burn
Exactly.
yourself and it would be too late. So
Exactly.
Is that
And so
related
We
to the
need it.
myelin issue? Because that
well,
surrounds the nerves, right?
myelin, we're not sure exactly because we
Okay.
haven't had any studies done on the MRIs yet. We're more looking at the EEGs because this particular protein hangs out between the neurons called the synapse. It's called it hangs out in the postsynaptic density is what they call it. If you're a
Okay.
science person, you probably know it just hangs out between the cells. It
Cool.
it helps one neuron talk to the next neuron.
Okay.
So when there's not enough protein, then those that electrical, because it's all electrical, right?
Mm-hmm.
That impulse or that message is being hindered. So that's why we are hopeful that possibly a gene therapy to restore the gene to making the protein will then allow those cells to start connecting again so that they can learn or they can regain some of the lost function that they had when they missed their milestones. That's the hope, because it was successful in our animal models at Scripps, Florida. Gavin Rumbaugh was the head of all of that as well. And we were successful in our adult animal models, in fact. Our Dr. Gavin's, and I should say, I say ours, I don't know.
Well, you're on Team SYNGAP1, right? That's
Yeah,
basically
exactly.
what you're talking
We're on
about.
Team SYNGAP, right?
It's like when somebody's part of the I don't want to say the Red Sox nation because New Yorkers don't like the Red Sox, but if you're a part of this culture and you're all on the same side of something, it's like we won the World Series. It's like, okay, well technically I
right,
wasn't on
yeah.
a team, but we
It-
won.
it was everybody's puzzle pieces coming together to figure that out, because when he was able to actually cure the baby mice when he used a particular therapy before they reached a certain age. So a mouse from birth all the way to 2 weeks old, he was able to reverse all of the effects of the lack of the protein, and they turned out from SYNGAP1 mutated mice to wild type, which was a regular mouse.
Wow.
And then he goes, well, I upset all the parents with that when I when I presented at your conference, because they were like, well, what about all these older kids? That's when he went to the older adult rat model, which is it's a different animal than they're all the rodents, but in science it's a more advanced animal. And he tested it on the adult animal models. He was able to eliminate 100% of the epilepsy seizures.
Really?
Which, remember, 90% of all our patient population has some type of seizure disorder, mostly absent seizures. And they're staring spells where you think you're dazing off and you can snap and you're not going to respond. And as me as a teacher, I'm looking at like, you know, how many kids actually had absence seizures where they're totally missing time, learning disabilities, things like that. So that's when my teacher kind of kicked in.
Sure.
And I don't know, just all started to come together. And when that paper came out about the adult animal models and his success of being able to eliminate the seizures, but it didn't improve cognition all the way, but it still improved memory. And this, they call this gene, the nickname for this gene in the scientific world or in the neurology world is called the learning gene, and learning and memory gene. And it's just been fascinating. And all this has happened. My son was diagnosed in 2012 at 4 years old. And there's a story in that itself. And of course, that's when I wrote my book of our diagnostic journey. Is if we would have started out with genetic testing to begin with, I would have saved so much money, so much heartache. Even though there was nothing there, I would still have a target.
Right.
Well, theoretically, because this gene was just discovered in humans in 2009, after the human genome was mapped, and now they're looking at all these genes, and we have we've gone from exome testing, which only tests about a third of your genetic code for mutations, most common, and then now we're heading into what they call the whole genome test, where they look at every single gene in your body to see if there's a variant there that could be causing your problems. And that's where we come up with the term precision medicine. So when there was nothing, I went to the geneticist. I went and took a loan out in the bank. My husband then did not like that. But I said, I have to do it. I have to know. And so I took a loan out, and because it was only on a research basis, I could get the exome at Texas Children's. And he was the first one at Texas Children's identified at Baylor College of Medicine. And then I found out he was the sixth one in the world.
Wow. And
I went, oh, I really feel alone. I really feel helpless. And the doctor, the geneticist, Dr. Scott, I love him. I still keep in touch with him. Every now and then I'll update him. And we actually have a center of excellence there at Baylor now, where our kids are being treated at the Bluebird Clinic. And he handed me a paper, and I looked at him and I said, "This is all you have?" He goes, "Well, I've never heard of it." He goes, "I just know it causes intellectual disability." And I said, "That's it?" And I said, "Well, that's going to change." I said, "This has to change." I said, "This is like the 21st century, right?
Right.
Modern medicine, you can map out the genomic code, and we don't, in the rare disease space, there's only 5% of all those diseases that have treatments. So what's happening to all the 95% that don't?"
Right.
And that it was I feel I'm justifiably angry.
Sure. Yeah. Understandably so.
Especially in the United States, we are one of the leading countries in the world. We have the most money. Well, I know China does too. They have a lot, but I mean, when you're talking about, we have the most rigorous drug. I know people wouldn't agree now. Okay, I know this is controversial. Okay, just let me explain. We are mad at the FDA for something, right? I mean, however, I work with the FDA, and they've been really gracious, and they actually really are trying to change working with patients, and they have been phenomenal. And I've had great experiences with them. And working in the international space, the FDA is probably one of the most advanced, most rigorous drug approval agencies in the world. And honestly, when you talk about drugs and you're talking about treating people, really you want something that's safe and something that has efficacy, right? But and there's a whole.
Are you sure they didn't hand you a piece of paper with some stuff scribbled on it? Hey, here you're going on Mike's
I swear. No. I mean, they. Well, here's the thing, though. I pushed myself into the FDA, and when I think they realized I wasn't going away. You're stuck with me, and
There
I'm
you
not going away.
Mhm.
You know, I'm a, you know, that's when I realized my son in this community and our parents, and I'm a parent, are suffering. You know, our kids don't sleep either. I mean, that would be another symptom. My son has gone 36 hours without sleeping. Can you
Wow.
imagine?
Really? Wow.
Yeah. And then you get delirious.
I've
And then
done that, but it's been a
okay,
while.
it's almost worse. Okay,
Yeah.
getting online when you're delirious, it's almost as bad as drunk texting.
Oh, they say, yeah, sleep deprivation is one of the worst things for
Oh,
you.
it is.
Yeah, yeah.
Yeah. So, you know, it's just been a very interesting journey, and I just pushed through, and I realized there was nothing there, and it's kind of like the movie Field of Dreams popped up in my head, like literally saying, "Build it, and they will come."
Yeah, that's good.
And
I would imagine one of your toughest challenges might be the fact that it is so rare, and you know, I've heard stories about how the pharmaceuticals, of course, you know, tend to focus just on what is profitable, you know. So
I,
how has that challenge been for you?
yeah, and you repeat that really quick, because my it's like every time somebody talks, my computer just goes
Oh, sorry. Yeah, I was thinking about how challenging this must be for you because oftentimes the pharmaceuticals tend to focus on, you know, things that are
Mhm.
not so rare because obviously they're more profitable, unfortunately.
Right,
Right.
So,
Yeah,
right.
that's true. If
yeah,
you
so
only
that
get six people who can, and if you
Uh-huh.
get this limited pool of people to sell to, and
yeah.
so one of our listeners asked that question, said, "How are you getting these tests and studies paid for? Insurance is on my hit list."
Okay,
Exactly.
okay.
Yeah.
So this is where I got involved with legislative policy, and I saw all these barriers that you're talking about.
Yeah.
Okay, pharmaceutical companies, yes. I mean, naturally, the economy runs on supply and demand. When you have a high number of patients, you're going to have a higher demand, meaning your economic, you know, profit margin is going to be a lot higher. Well, the rare disease community as a whole, and I have been working in this space for 10 years, is really just come online. I think along with some other groups that started about 10 years ago, I was probably I was one of the first organizations, and people said, like I said, I'm nuts. I don't care. Life is all a risk. You got to take a chance. If you don't go all in, you'll never know what it was going to turn out to be. And people told me, even my first the first people I talked to try to get a board together said, "You're not going to be successful
Mhm.
because no, this isn't even a named disease yet. It's a
Right,
gene
right.
mutation." I said, "I
Mm.
don't care." I said, "I know I'm going on a mom gut. No, I don't have a PhD yet, but I said, you can't let people suffer when we started out with 3 people. After I wrote my book, turned my blog into a book. And fast forward, a parent found me 6 months after my son was diagnosed, and she knew of another parent, and we started a Facebook group with 3 people.
Mhm.
And that Facebook group now has grown significantly. And but the rare disease space then, and when I started this organization, I was one of the first, if not the first, organization in the world to start um, a nonprofit. We are a 501(c) that focuses on a gene mutation. And people said I was crazy. They go, what is our base going to be? And I said, well, they say it's linked to autism, and it's an epilepsy gene, and people have intellectual disability. I said, you got to start somewhere.
Right.
And I started off with that paper, reached out to the researchers on that paper, talked to them, and they realized, oh wow, this we could build a patient population. So when I saw all these barriers coming in, I was like, well, how, I was reaching out, and I think the first year I was like, well, I can get money from pharmaceutical companies. No.
Mm. Mhm. Right, right. Yeah, that's
They
what I was thinking.
ignored all the grants
Yeah.
because it wasn't, nothing that was there to incentivize them.
Sure, sure.
Sure.
So there is a part of the or in 1983, the National Organization of Rare Disorders was the first organization established in the United States, which we work very closely with. And they passed a law in 1983 called the Orphan Drug Act. Now, the Orphan Drug Act was created to incentivize companies to take on rare diseases to try to repurpose drugs. Because do you know how many millions, if not billions of dollars are sitting on a shelf somewhere that is not being used, that was created for an indication that's no longer used?
Right.
And the drug is already created. And because of patents, because of licensing, because generics are out, because the pharmaceutical company has manufactured it, they no longer have an exclusivity to market it.
Sure.
That's where they make their money. They have you have the brands, right? That's all exclusivity marketing. And so when you go to commercialize a drug and you run out of that, and then you make generics, you're now in competition with generics. So they're going to go shelve that, or maybe it's not a good indication and it didn't work and something else came out better, but that drug is still there. So part of what the Orphan Drug Act was, and also PDUFA, which is PDUFA 7 is actually coming out. It's being formed now, and that's different areas of regulatory law where they have the FDA and congressional law come together and really try to make more of a patient-focused process, and where the patient is involved in the drug development process. And in 2016, I was very honored to be recognized in the House of Representatives. Congressman McCall told our story on the floor, and for the pediatric review voucher program. And what this is, it has to be reauthorized every couple of years, or every couple of years it has to be reauthorized, meaning it's got to be refunded. And what this is part of the I think it's part of the Orphan Drug Act. I can't remember off the top of my head because I don't have it in front of me. My health law is getting me confused a little bit, but it's to incentivize companies to be able to buy these vouchers. Let's say that you do have a patient population and they have a drug molecule, and it maybe has an indication, or they're going to develop a new molecule, possibly out of something that was working. And something else, and they take that voucher, and they buy this voucher, and they give them money from the federal government to work on this. If the drug is successful, then they get to sell that voucher back. Okay. And also the Orphan Drug Act, it used to be 50%, and it was called the 21st Century Cures Act was passed a few years ago in 2018. We advocated for this law to be put into Congress. I think, we advocated for it for four or 5 years, and we finally got it passed into law. But every so often reauthorizations come up, and they want to tweak it. They you've got all this stuff, wheeling and dealing on the congressional floor of how they're going to allocate funding to whatever. Well, it used to be 50% to companies, a 50% tax break. Well, now in the last few years, Congress knocked it down to 25%. Now they only have a 25% tax break, which really doesn't help us.
Right.
But advocating for those types of laws will help pharmaceuticals companies take on rare diseases. And if you can find a link and know the biology of what's going on in the disorder, and link it, like our particular protein is linked to schizophrenia. And it's one of the top 10 genes identified a couple of years back as linked to schizophrenia. It doesn't mean our patients have schizophrenia, but it means that the protein behaves a certain way, maybe talking to something else in the brain. We just need to figure it out and possibly a new indication for a drug that either helps people with schizophrenia, may help our children, and vice versa.
Right.
So that is kind of the direction that we're going, because we're looking at the protein function and we just don't know all of its functions yet. So did I answer that question, or did I totally miss that question about getting pharmaceutical companies interested?
No, I think you touched on it. And I think, it's, unfortunately right in line with my thoughts on it and what I've seen, where they, they're not going to offer as much assistance, unfortunately, but it's great that you're putting so much effort into making a difference, because, the people who are impacted by it obviously are struggling and dealing with it. And just because there's fewer of them doesn't mean it's any less important, of course.
Right.
Yeah.
And one of the other big pieces of legislation that we're trying to pass at the federal level, because as you know, federal government is big, right? It's broad spectrum, right? And so they leave a lot of the health decisions to the states, and a lot of people don't know what the quality is, and it's basically the quality of life value on a drug, and it's a formula they use to determine the price of a drug, and there are large institutions, nonprofits, and of course you've got the drug companies that lobby to use this particular formula.
Mm-hmm.
However, how this particular program called the QALY, it was banned in Oklahoma, by the way.
Oh, okay.
It was the first state banned. They banned it because it goes against ADA laws. It's discriminatory against people that have disabilities. Because how the formula works, and a lot of people don't know how the healthcare system works. In the nuts and bolts of it, they think insurance. I'm going to go to the doctor, get insurance to reimburse, but everything's contracted out.
It's a dirty business.
It really doesn't work too well.
And you're telling me. And so
you should see some of the comments here, by the way. Yeah, we got some people in the comments over here who've had some miserable experiences, it looks like.
Well,
but I didn't want to cut you off.
Yeah.
I don't want to throw ICER under the bus, but no one knows what ICER is. So ICER is the one who determines a lot of these high-priced drugs that you have based on the quality. And we're
throw them under the bus. They said, throw them under the bus. Go ahead.
Please. Yeah, we do it all the time on the show.
Because many of these therapies are going to be gene therapies. I can't afford $1 million for a gene therapy. My insurance company's not going to afford a gene therapy.
Yeah, of course.
We have to figure out a way, and it takes about that much to develop a gene. If not, we're talking $44 million just for a regular drug, not gene therapy. And that's if it works in a clinical trial.
Right.
So I understand that pharmaceutical companies have to recoup their R&D, all the money they put in. I get that. But when you throw insurance companies in there and they're contracting out these exorbitant prices, and they're using these formulas like the QALY that don't work. It works for common diseases. Okay, got a strep throat. Okay, well, I can afford an antibiotic for $10.
Right.
But because everybody has, it's common. Strep throat, appendicitis, whatever. Those are all common procedures and diseases. But when you're talking about, say, muscular Duchenne, okay, these are deadly diseases for these boys, and so they're working on trying to save their boys, and they do have a therapy, but they can't get anybody to cover it. And how the QALY discriminates against people with disabilities, because these people were born with the disease. It's like you take the drug. I'm going to try to put this in layman's terms, and if I hope I don't misquote this, but this is how I understand it. Looking at the QALY, the quality of life value, you're actually putting a value on someone's life based on how much they're going to pay for the drug, right? So if the drug doesn't work very good in comparison to a normal person, then the drug price is going to be much higher. Okay. If the drug works really well and compared to the life of a normal, healthy individual, the price will be low. Okay. Now, the reason why this does not work with people that have disabilities is because the QALY is only looking at the life comparison of a normal, healthy human person.
Right.
My child wasn't born healthy.
Yeah, you're not going to get there. Yeah.
Yeah,
Oh,
you're not going
yeah.
to get it. So it's discriminatory because when you look, I mean, my son developed at half speed, so you're talking about half the quality of a life that a normal person would have.
Right.
So they're using this formula, and they're cutting out 50% of it's like a student going into a classroom. One is blind and one is not, and then you give them the same materials and say, here, learn this, you learn this. This kid can see, this guy's blind, kid is blind, and you give them the same test, and you're like cutting them off at the knees.
Right.
And they won't get the same score, right? So it is discriminatory. So we are actually fighting that state by state.
Yeah.
It was passed. Oklahoma actually just passed a law last summer. You can look that up, and they
God
banned.
bless Oklahoma.
That's
Mike knows
right.
Oklahoma.
And so we are working state by state to try to get states to ban it. It's unfair for people
is.
that have disabilities that were born with disabilities.
We do have a couple
So-
of questions here.
Sure.
I wanna see if we could throw these at you. I hate to interrupt, but
Oh
we've got
no, okay.
we've got Jeremy.
Uh-huh.
Message retracted. Oh, never mind.
Oh, come on, Jeremy.
I can't see it. Jeremy got shot.
Talk
all
to
over.
me.
Put it back in there, Jeremy.
Well, one of the listeners, DG, said some things about the FDA.
Uh-huh.
I just battled my insurance for 2 weeks to pay for a brand seizure med that I've been on for 7 years, and because the FDA, aka the government, my insurance is insisting I go back to generic that I can't take. I don't think that you were saying the FDA is perfect in any way. Is that what you're saying?
No, not at all. I think a lot of
Certainly
people.
flaws in the system.
Couple
Yes,
And
people
anytime
step
you've got
down,
big government getting involved and you're gonna have problems. You know,
Right,
and I
right.
think that a lot of people just don't like the idea of the government dictating,
Yes, yes.
you know, what you can and can't take and what's best for you. I
Right.
certainly get that.
Mhm.
And insurance companies could be a nightmare to deal with. I know that I've had loved ones in my family who had things that were clearly covered under insurance and called in. What is the specific policy? What criteria have to be met? The criteria are clearly met, and they keep issuing denials. You know, denial,
Yeah.
denial, and you have to
Mhm.
continue to appeal. I don't know
Departments
people
dedicated
do.
to it. Yeah.
I don't know what in the situations that I've been through where I've fought for family members, I don't know what somebody would do if they did not have a loved one who was a lawyer and who was going to spend days and days and days on the
Right.
phone and just nonstop threats and nonstop fighting in order to
Mhm.
get the stuff covered.
Mhm.
I'd venture to say that 99.99% of people give up before they get to that point. Have you
You're
dealt with stuff
exactly
like this?
right. Oh yeah, yes, I have, and I still do. And I think that's where understanding, I guess, the process. There are many ways you can get access to a drug through the FDA. There are many different programs. There's like the expanded access program. You have you can ask your. Of course, clinical trials are different, but there are different applications. You can go to the drug company and ask them for a new indication, and there isn't like right now there is an epilepsy drug that many of our children are on that work, and it's not because they have a SYNGAP1 diagnosis. It's because they have a Lennox-Gastaut diagnosis, which is a clinical diagnosis, and an insurance company has their I would say their what they call their formula list, and they'll only cover certain things because of the deals that they've made with companies, and
Wow.
and really what price they can get. I mean, it's all oh god, and it's frustrating. It's so ridiculously complicated. When I took health law this last semester, I saw the anti-kickback laws that hospital systems have to follow. And then I think it was the Sherman Act. You've got
Antitrust.
value-based. Yeah,
Yeah,
it,
yeah,
uh,
because combination contract or conspiracy to restrain competition. That's classic
it,
Sherman Act, right?
I
I'd
think
imagine they're all working in cahoots to say, okay,
there's
here's what we
so
got to do.
many loopholes.
Mm.
Well, I wouldn't say loopholes, but it's just the law is very.
Well, I think more
It's
people
so
on the inside of the system need to stand up more too. And it's interesting because
yes.
I think a couple days ago, a couple people in the
Mhm,
FDA, high level officials, actually stepped down because of the administration pushing
mhm,
these booster
mhm,
shots without
mhm.
scientific evidence yet.
And on yes, and I have to say that I legislators don't need to tell the experts what to do, in my
Hmm.
opinion.
Right, exactly. Yeah.
And because legislate see that's why I advocate on the Hill. Your legislators do not know. It is our job, guys. They work for you. You know they are they are your employ. I guess you're their employer.
Hmm.
You need to treat them like that. However, they don't know everything. And when you go in, whether you're Republican or Democrat, it doesn't matter. They need to see why you want this done and your living situation and why this law, why this piece of legislation isn't good. And you don't have to know anything about law. You just need to know that this doesn't work. We need to change it and come with a solution. Don't just complain. Go to them. Think about, even if you don't know law, it doesn't matter. It does not matter. This is where ideas come from. This is where solutions come from. And then get them to write it up, get a bill together, and present it. And I find it, I took constitutional law. That's the very first class I took last fall, and I found it very eye-opening that only really 1% of all the bills that are presented even get to committee, or
Hmm.
maybe was it 1% or 11%? I can't remember.
Wow.
They only get to committee. So that's why you need to be in their faces. Find out who sits on these committees.
Hmm.
Reach out to them. Tell them what's not working and why it needs to change, or tell them what is working. But yeah, the FDA, they do have experts there, and there are laws that are passed to try to incorporate the patient voice, because without the patient voice, nothing's going to change. And no, if they don't know, then they can't make better decisions on making better rules and regulatory statutes and laws. So that's why I'm up on the Hill. I mean, I out and they hear me coming. So, but it's just something that really empowers you. Get to know them, build a relationship with your elected officials. Doesn't matter if they're not your political affiliation. Get them to work for you. They
Right.
work for you. But come with a solution. And I don't know if that I don't know. I kind of get off on a tangent. I'm very passionate about this, and I have found that really changing things at the top is the only way to change things at the bottom.
Right.
And
Well, oftentimes I think it takes someone like yourself who, has a child with the situation, somebody who's intimately involved with the situation and cares enough to take action, because otherwise these things just seem to go to the wayside, unfortunately. Yeah, especially with the
Mhm.
profitability and the economics of the whole situation, like we talked about.
Exactly. Yeah. And it's sad that sometimes money is the bottom line, but you've got to use some incentives to dangle a carrot sometimes,
Hmm.
to show them why they need to spend the money to make it better,
Right.
or it is very frustrating. It is. I totally get it. I totally get it. But
I think there should be like a pool of money that goes from all the other drugs that are sold, for folks that have the common ailments, to help people maybe who don't have, the common ones. I don't know if there's something like that, but, maybe a certain percentage could get allocated differently to help people who are,
yeah,
not in the
I,
norm.
Right. And I think we've been trying to go to drug repurposing and passing the Open Act in Congress again. And it was kind of when COVID hit, it kind of put everything legislatively on the back burner, for a lot of bills, right? But even at the state level, because if you have to advocate at the state level too, for I advocate here in Texas for newborn screening, and we were able to. This is what's funny, I guess, is that once we started digging and figuring out why wasn't there enough money to pay for the labs in Texas and to add new diseases to the from the RUSP onto the testing, newborn screen testing. And we found out that all the reimbursements from newborn screening that they how they prick the baby's heel and they do the little blood spots, and they go and test right after they're born. Well, all these reimbursements they were getting from like Medicaid and insurance were going into the general fund of Texas, and we were like,
oh really?
No. And it took a simple fix. We went, we stormed the Capitol in Austin and said,
you can't say that these days. You can't say that.
Yeah, right.
Oh no!
You had your own insurrection.
Is that a bad buzzword?
They're gonna show pictures of you with a helmet with horns on it.
Right.
Sorry, but we did.
Let us know when you're doing it again. We'll fly out. Yeah.
And we went and gathered a group of bipartisan elected officials and said, look, you know why you don't have money in the budget for newborn screening and to update the lab and add new diseases to the RUSP? Because I could say, let's say SMA is a new disease that they added to the RUSP recently in Texas, and let's say Oklahoma had it on their RUSP. So a baby born in Oklahoma could get tested at birth for SMA, but you're born in Texas and couldn't. So that child stays sick, but he's getting treatment in Oklahoma.
Right.
You see? So all of these states are doing different things, and it's really a disservice because, to the newborns that maybe have diseases that have already been identified, and then they go months. Because you're talking about millions of dollars.
You think that wouldn't be so inconsistent with all the modern technology these days, right? Yeah.
Exactly. And so
Jeremy finally got us his question. He says, I was just wondering if the genetic testing you were talking about is similar to that used to test in vitro for Downs and other disorders.
Yes, it is. It is. It's either a whole exome. Well, there are different types of genetic tests. So you have panel tests that target certain diseases, already identified diseases, like an epilepsy panel. They have speech panels, which are much less expensive and more affordable, and insurance companies are more likely to pay for those. However, if it's not that, then you got to go to the next step, which would be the whole exome, or the whole genome. But the exome is a little bit more expensive. That tests a third of the genes, which is what my son was diagnosed on. But a lot of new genes that are being discovered, there are new genes being discovered all the time that do different things, and or that cause disease. And these are definitely similar. They take probably what they call a panel test and run that for testing for genetic testing. So, but it is expensive. So did I cut out on you guys?
No, you're good.
Okay,
No,
good.
you're good.
I noticed. I don't know if you know about this or not, but the these DNA tests that people send in, like Ancestry and where you do the saliva and all that, and now it seems like they're offering some sort of genetic information about possible diseases you may have. I can't imagine they're that robust, but I don't know if you could speak to that at all, like what they're doing there. Or if that's
I know a little bit about that. I know that there are several companies. Well, they have to get permission actually, because it's a different. This is where health records and HIPAA law comes in.
Okay.
Because you've got HIPAA privacy, and then also a lot of people when companies do genetic testing, they have to be certified a certain way. So there are high certifications, and then there are kind of midline certifications on the quality of the test that they're doing.
Oh, okay.
So, I can't speak to the types of tests that these types of companies are doing, to get your ancestry done, but they have to fall within certain qualifications of the genetic testing standard, like
Yeah.
getting a gold seal, right?
Right.
And I know that I think there was one company that was allowed to do testing on, I think, 10 diseases. But they had to go through it's like a lot of red tape.
Sure.
It's a totally different structure because, I'm also the primary investigator on our database. And so you have to, there's so many regulations around data privacy, how you store it. I have to have cybersecurity insurance policy on both our databases because we have one for storage and one that we actually collect the survey information from. And so these companies have to do the same thing. So it's all around compliance.
Okay. Right.
Compliance and regulatory laws in the data space. And that's one of the things that I'm studying in health law right now or in school is the laws haven't caught up. AI is only good as a coder, and if you have a coder coding for science, biology terms, medical terms,
Yeah.
if they don't know the terms, then you could be missing something, and you're not gonna have the best quality.
Garbage in,
analysis
garbage out.
Yeah, exactly.
Although
So,
the AI stuff is pretty fascinating now, what they're doing with it.
it's good for machine learning for sure.
Have you seen the Neuralink that Elon Musk is doing? We were talking about some of the brain stuff earlier. I don't know if you've seen what he's doing.
I have
with Neuralink.
not.
Oh,
I'll
okay.
have to check that out. No, I have not.
Okay.
I haven't
Yeah, it's like a
haven't seen that yet.
brain
Billy
interface.
Chris's man crush, right?
Yeah, that's right.
Elon, they're obsessed with Elon
I
Musk.
follow him on Twitter.
So
Yeah.
let's talk a little bit about the human aspect of all this. What is it like being a parent and recognizing that you've got a child who's suffering from this condition that is so rare and there are so few resources because of how rare it is? Is that why you had the drive and the desire to take something on your own? You realized, hey, there isn't something to meet this need. There is this need, and damn it, if nobody else has got something already, I'm going to start it from the ground up. Is that sort of where that comes from?
That is because and I hate to, I don't mean to sound cold or crass, right? I don't, but people have their lives. People are trying to survive themselves, right? And I found that I had a skill set being a mom. I'm sleep deprived. The meltdowns, and those of you listening in who have children that have autism, you know what I'm talking about. The broken, smashed iPads. In fact, there's been 2 in my house this week. And OtterBoxes are great, and I didn't have one on one, and so I'm going to be purchasing another OtterBox for the iPad. But it is when I realized that my son could not tell me or speak what he was feeling, what he was thinking, how his day went. Did somebody hurt his feelings? Did somebody, and the confusion in his brain. He went 5 years undiagnosed with seizures because I could not get a doctor to listen to me. And I said, I know he's having epilepsy. He's jerking around. And they told me, Mom, you're just, a helicopter mom.
Wow.
I said,
I'm going to get us fined with the FCC for what I'm about to call them. Because I've dealt with loved ones who go undiagnosed for these situations and they pass you off and you go from doctor to doctor, and there's nothing more frustrating than that.
It isn't. And it becomes ego. And I'm like, you know what?
Right.
I've gotten
Mhm.
over that. Get
Mhm.
over your dadgum ego. Now, not all doctors like that. I'm not speaking for everybody because
No,
I
but
found
there are a lot
yes,
of
there
them.
There's too
are.
many
Yes.
of them. Yeah.
And I think I put a meme out that says, hey doc, uh, don't take your 6 hour class or your 6 years of law school and the one class and the 1 hour class you took over my experience living with my disease for 20 years because
Right.
that's where I mean patients are first, and that's what I believe, and that's the activist coming out of me.
Yeah.
And I went and when they send you away like there's nothing we can do,
Right.
why? I want to know why.
Yeah.
And I didn't stand. And that's why we went to 19 specialists. And I finally found, I found two neurologists that listened to me. One that actually diagnosed Beckett. He listened to me. And he's here in Houston at the Houston Sleep Study Center. He's over. Oh gosh, can't even remember the name of the place. But after him, then we begged a junior PhD doctor who was at the Bluebird Clinic at Baylor, and he was already studying another rare disease called SHANK3, which is the Phelan-McDermott syndrome, which SYNGAP1 and Phelan-McDermott are right next to each other in the cell line, and our kids have very similar symptoms.
It sounds like they're all kind of tied into each other and related. Yeah.
Yes, absolutely. And he took us on, and he has made a huge difference in my son. But knowing, I couldn't imagine, as you can imagine, my son is for the most part nonverbal. I don't know how anybody could be nonverbal it just and live that way because I'm such a verbal person. So I have, can you tell?
You don't say.
So I'm already on chapter 21 of my book.
I saw your book is on Amazon, by the way, right? If people want to get your book, it's on Amazon.
My book is on Amazon. It's not in hardcover yet. It's a small book. It's the diagnostic journey of my son. And but once I get my second book written, then I'm going to put both out in hard copy.
Cool.
But yeah, it's just I had to be his voice, and if no one else was gonna speak for him, and I just became we call them a rare grizzly mom, and then there are those rare grizzly dads out there too, and because no one else is gonna fight for you. And you have to do it. And the reason why I took on this challenge, because I didn't, when it came down to all of my learning disabilities and the things that I had to struggle with and cope, I was my parents' strong-willed child at 2. I never took no for an answer, and I still don't take no for an answer. And I wasn't going to take no from a doctor who told me there was nothing I could do for my son. And I said, not true. And I'll show you. Watch me. And that's when I started the organization. I didn't have one business class ever. But I do remember reading a really thick IRS handbook on starting a nonprofit.
It sounds riveting.
Probably a good way to go to sleep at night.
Yeah.
Beach reading, right? Head out
You know
here
what?
and light up a cigar and
Right.
read the IRS handbook.
I know,
on
right?
nonprofit.
It took me 2 years to get the courage enough to do it.
Yeah.
And that's when I got into the policy, and I realized,
Just
we had to do
looking
a
at it, sitting on the other side of the room, and be like, "Oh man, I'd rather gargle with razor
Yeah.
blades than eat that thing."
and I won't even.
Maybe I'll start that tomorrow.
Well, I will tell you. I won't even tell you how many buckets of wine corks I have. I ought to tell you what I do after my kids go to bed, or if they're sleeping, I'll just sit there and watch them and gaze.
We have to
But-
have a wine cork
Yeah.
competition on the show sometime.
Yeah, and I think the good Lord above gave me enough hyperactivity to take on the energy to do this, because I see the parents that are tired, and I had the energy to do it. God gave me the skill set to do it, and I took it on, and believe you me, there are still challenges. Trust me, this is
Mhm.
not a cakewalk, not even in the business realm. There are politics, there are discriminations. Especially me being a woman that's in a pretty much in a man's world, and I'm not, I don't mean to sound like a I'm not a feminist, but but I am a hard-headed, loud, um, bat crazy woman.
Well, you fit right in with us perfectly then.
But the person I am today was not the person you would have seen walking through the halls in high school at
Mhm.
all.
Mhm.
And it's because I decided that I wasn't ever going to have people label me.
Mhm.
And I got a wild hair about a year and a half ago. Well, yeah, about a year and a half ago, maybe November, December, before COVID. And I applied. I was working on a committee, a CBD committee, with a group in Washington that I'm on. And I testified actually at the FDA to try to deregulate CBD so that we could do research on it and use
Mhm.
government funding to
Oh,
do it.
wow.
Because
Yeah, there's some
and
fascinating stuff going on with CBD. Yeah.
it is, and we're writing. We're looking at the laws carefully and
Mm.
trying to troubleshoot where we can navigate the easiest to
Mm.
try and it. I mean, at least take it off Schedule 1 and put it on
Right.
Schedule 2,
Mhm.
and let's get some government money in it, because there is the one, and I'm not plugging them, but there's one CBD, pure CBD, that was approved by the FDA to treat epilepsy, and that was Epidiolex.
Mm.
And
I remember seeing videos of children, their
mhm,
parents getting it, almost on
mhm,
the black market and giving it to their kids, and they would
mhm,
literally just be seizure free
Well,
mhm,
I
after
mean,
that.
that's
Yeah.
something that's nuts. They talk
Yeah.
about government overreach.
Right.
The
Right.
mhm,
government telling you as a parent that we're not going to allow you to use
mhm,
this medicine to treat your child who is
Right.
suffering because
Right.
we
mhm.
know what's better for your child than
Right.
you do, or
Right,
we know
right.
what's better for your loved
Hmm.
ones or
Mhm.
Sounds
yourself
familiar.
than you
Sounds
do.
sounds like the past couple years here.
It sounds like government in general, right?
Yeah,
Right. Yeah. Well.
exactly.
Yeah.
But you want it to be safe.
Right.
You don't want people peddling it to make. I mean, there are those bad actors in the
Sure.
space,
Sure.
because and so that's why you want the FDA in
Yeah. That'd
place.
make
You
it
know,
legal,
that would
and then you can
right. You
regulate it.
make
Yeah.
it
Keep it
legal,
safe.
and they can regulate it in a way that you're keeping the bad actors out of the space,
Right.
and not producing it. Because marijuana plants are like the catfish of the ocean. They
Hmm.
are,
Hmm.
because they I don't know if you guys know this or not, but marijuana actually sucks all toxins out of the soil. And so when you've got lead, mercury, arsenic, and all these different heavy metals in
Hmm.
the soil,
Oh, I didn't know
those
that.
plants, yeah, those
It's
so it's
filtering the
very,
soil. Then it's like healing
yes,
the soil. That's
yeah.
interesting.
And so, and then it turns out in the flower of the plant, which is what they use,
Hmm.
for to get the CBD. So,
I thought you meant in order to catch the plant, you have to stick your arm into a cave somewhere and see if it bites you.
Depends on how well they're hidden by the cartel.
I know, metaphorically.
Yeah. Right. Right.
But so I'm involved in all this because it directly affects the community that I'm serving.
Mhm.
And I want, I've heard, stories of our parents calling me, and then they call their doctors, and their doctors don't even know what to do. Well, you
Right.
used a
Right.
CBD off. I don't know what's in it. And then the drug interactions, certain seizure medications that are the pharmaceutical seizure medications that our children are on, if they're taking CBD and interacting with that particular drug, there's an interaction, and it's going to cause the liver to be overtaxed.
Oh, is that
So
right? Oh, okay.
yes, there are certain chemicals, that are done, but all this work was done in the UK, and by the people that made the pure pharmaceutical grade CBD.
Mhm.
So, but we need to start looking at it here because they, I've heard too many horror stories of some of my parents having to bring their children to the emergency room because of a bad batch.
Oh, really? Okay.
And yes, and
Wow.
and then when
Good to
so
know.
I was one of the 120 that was selected by the FDA to testify on behalf of the epilepsy and rare disease community on CBD. In May of 2019. It was quite nerve wracking. I didn't know I was on Fox Business Live.
Wow.
I had no idea. But this has been it's been an experience. Just diving into it, just diving into the whole space, and I've had challenges. I've been when you rise to the top, there's always those people that are going to try to shoot the arrows and bust your bubble, right?
Mm-hmm.
Sure.
So I mean that happens, and I don't understand why it happens, but people come at you, and
Knock you down. It happens to Mike all the time. People chase him in the streets because he's top of town.
We get all kinds of hate mail.
That's right.
I was gonna wait till she was gone to talk about the hate mail that we got this week. So
Oh, really?
Yeah,
Oh, we got some more?
I was
Oh,
so hoping
fantastic.
I could fly to Philly and be with you guys live.
Come on,
Oh,
come on over.
Next time.
I can just imagine you guys are a hoot. So, but
next time we certainly will. Perhaps when you're on the East Coast in Washington.
Oh, yeah.
That's right.
Absolutely. I've got to figure. I know I'm going to be in Boston in October, and I'll be in Boston in December. I do a lot of public speaking.
Mhm.
Well, okay. Since COVID, it's all been Zoom. I used to travel, a lot, and I have my older kids help me a lot, and their dad, helps with Beckett when I travel, and so it's just been a wild ride. I'd never knew that I would go to teaching students in a classroom, sixth graders, which sixth, seventh, and eighth is I taught that level for 14 years, and I taught high school for 7. I taught college and high school 7 years.
And science. Taught science.
All science. Yeah, I
Awesome.
taught chemistry, physics, biology.
Awesome.
Didn't you say you got a D in chemistry and now you're teaching it?
And you know what? But I passed the test. I know, but it's so funny because teaching it, I had to teach it to myself, to teach it to my kids.
Yeah,
So I
because you don't
learned
want to look fool. Yeah, no, that makes sense. That makes sense.
Well, I'm surprised they let me in a classroom anyway.
All right, class. I'm pretty sure this is. don't take it from me.
Okay, and this tells my age too. When I taught one of my 8th graders, gone to college, and then they hire him like 10 years later, and he comes back to teach in the same school across the hall from me, and ask him, so do you remember anything I taught in high school? Or in middle school, I mean, when I taught you in 8th grade, he goes, all I remember is you getting up standing up on the lab desk in front of the room, singing the directions because no one would listen to you.
Wow. Do you remember that song?
I said, I don't remember that. And he goes, you did it.
You don't remember the song? We were going to ask you to sing the
I
song.
don't even remember. I have no idea. I just knew I was appointed in 7th grade. I had to teach human reproduction. And I don't even want to know.
I was going to say, Russ is going to have to edit out the rest of this.
I don't know. Okay, so
it's a family show, Monica.
Now the show's just getting good. Hold on a minute now.
I know that you really want to shut some 7th grade boys up.
Oh yeah, I bet.
Okay.
Goodness.
So I can't get in trouble for this because I didn't get in trouble for it teaching school 7th grade because
the problem is that we're gonna laugh. Chris and I are gonna laugh hysterically, and everybody's gonna know that we're just the same as teenage boys. So.
It's okay.
I'm going backwards.
Do boys ever really grow up though?
What's that? Russ is actually closer to a teenager.
There's Russ.
Okay,
ladies and gentlemen, Russ.
I told him, I said, we're going to get this out of the way right now. And I said, okay, and you're going to say this with me.
Oh, no.
Because you're going to have to label a diagram.
Be careful.
It has these words in
Yeah.
it. And you're gonna pull them
So,
off.
Monica,
What was on the
how
diagram?
about them Yankees?
I'm gonna keep
I-
pushing it. Keep
I
going.
do want to ask you a serious question. though.
Okay. Okay, well, you can only
I don't know how I'm going to segue. I don't know how I'm going to segue.
BBB.
Uh,
Say it. Everybody say it. I never heard a peep out of them, and they all behaved.
What was it? I missed what you said. What?
I said, I
No,
just
she didn't
fill in
say.
the blank. I said, P. Say it.
The 3 P's.
It starts with the letter P, human body part, and then I said BBB.
BBB.
Say it. And this was a mixed classroom, and of course you have the little girls going hee hee hee. And then some of the questions I got in the question box, I would just say, I'm putting that one back. You need to ask mommy and daddy that one because that's not my pay grade.
Right.
Well,
right.
that's I don't want to go into a different topic here, but
No,
that's
that's
actually
okay.
a good point. Is that the role of the parents should be being involved and doing these things in their children's lives. It shouldn't be left up to the government, the school
You
system
are
to do a lot of these things.
spot
Yeah.
on.
And
You're
the,
spot
Too
the
much of that
fact that
going
the
on.
parents in a lot of these situations push that off onto the education system or push that off onto the government. They shy away from it. Hey, that's going to be an uncomfortable conversation, so I don't want to have that. Somebody
Yes.
else will take care of it. No.
Right.
That's your kid. That's your responsibility. You need to get in there and roll up your sleeves and do it. No, it's not going to be comfortable. Maybe you don't like it,
Mhm.
but hey, this is what's going to happen. And then we've had generations of parents
Mhm.
pushing these things off. And no wonder we've got these generations of kids that are so screwed up.
Gotta
and
be
going through-
involved.
Sure.
I mean,
Now we have
yes.
critical race theory.
It's
Not at all controversial on this
Right.
program.
Right.
So when you said before, you said something that you said this is going to be a whole lot of controversial. And one of our listeners said something along the lines of, we do controversial around here.
Okay,
This is
okay,
exactly
yeah,
what
yeah,
we're
awesome,
doing.
awesome. I try to behave on social media. I have my board chair every now and then call and go, why did you post that? Because it gets attention,
Yeah. Right.
and it's true.
Right. Well, you have a
Mike's
culture
doing-
today
Well, only
where
if it was fact checked. If it
well, exactly. There's a very toned down and censored version of discussions.
Yeah.
We don't have a free and open exchange of thoughts and ideas the way we do on this program.
And I'm
And-
very, very. I like to listen to people and listen to point. Here's, I realize that perception is reality, but it's only your reality because you don't know all the facts.
Mm.
And so I think people stop there and they don't go and ask questions
Mhm.
around what is there. And if you don't know the facts behind a statement or meanings of languages, and that's what I'm learning in law school now, is how important you state something and how you use language. Because even when we were doing the CBD stuff, may and shall in a piece of legislation means something totally different. I mean,
Yeah.
it would change the game altogether. And so these are the kinds of things I think like a scientist, and my law professor said, you're going to come out of this thinking like a lawyer. And it
Mm.
really does make you stop and think. And it would be a good skill for everyone to have before you come up with I don't know, assessment of something. Do your research.
Sure.
That is so frustrating for me because people assume things and they don't know what primary resources are.
Mhm.
Right.
Learn what a primary resource is. Don't depend on secondhand knowledge.
It's worse than secondhand, though. If you
Oh,
read
yeah,
articles these
yeah.
days, they don't even link back to the primary source, like you're saying, which in a lot of situations would make sense. You're talking about a law, you say the law, you put a hyperlink there where somebody could go look at the law. No, they have links to 9 different articles talking about their opinion on the law
Right.
before you can
Right.
ever actually get to the text of the law. So
Exactly.
I think they intentionally make it difficult most of the time, to be
Well,
honest with you, because it's
well,
much easier to brainwash people.
well, yeah, and knowledge is power. And when you have knowledge and you have the expertise and the knowledge to navigate, people can't take advantage of you.
Hmm.
And
Wow.
I have to say that one of my colleagues that works on the Hill told me, because he said, if you're going to work in DC, you need to read one book. And that book is 48 Laws of Power. I don't know if y'all have read that book, but it's a political philosophy book that and I've had people kind of poo-poo on me because they say you're going to learn how to manipulate people. No. That book is teaching you who's manipulating you and how you are going to respond to it.
Ah,
Interesting.
I mean,
Okay, that's good.
if you are going into a negotiation and or you're going to speak to someone about either getting something or they want something from you, it teaches you how to ask the right questions.
sure.
Because if you allow somebody to use you, they are. You
Mhm.
allow somebody to use you, and I got tired of being used. I got tired of being naive. That's one of the reasons why I'm in law school, is because I learned the hard way starting out, this organization. Because granted, I didn't have any business, but I wanted to do it right. But I had to educate myself. And if I didn't educate myself, I couldn't protect the best interest of the mission of the organization, or even strategically move forward right.
Right.
Without
So,
thinking
so you
of-
see this for lobbying, compliance? Sir, it doesn't sound like you're talking about any litigation or anything like that.
No. I mean, it's just in general. I mean, we have to, since we own a database, we have our own asset, which is intellectual property.
Right.
And
Okay. Yeah.
that medical data is very valuable. And so, and my belief is especially in patient organizations, and we were one of the 20 organizations way back in 2016 who were awarded a grant that was funded by the FDA to create these patient databases where they were owned and stewarded by the patient organization, because of all these different silos. Because
What's
you've
the
got
password to the database? I'm just kidding.
I'll never tell. And
Have you tried
I have it
Guest?
it's encrypted, and I've got we've got special, you've got all, well, you would think all the firewalls, but
Right.
nothing's 100%.
Well, nowadays it's crazy. Yeah, everything's so
Yeah,
vulnerable.
it
Yeah,
is.
yeah.
Yeah, and so I mean, we do contracts, and if you do a contract, I've noticed, I've read some contracts, I'm like, and I'm taking contract law, which is a required class, my last required class for my degree, and then the rest are all going to be electives. But you can read an entire contract, at the very end it'll have like this subclause in there that says, if you do this, it's going to negate everything you just read.
Right.
And I'm like, and if you don't know how to read contracts and negotiate and
Yeah.
learn the steps and what language means, you're going to get screwed.
Yeah,
I mean,
a lot of
that's
people
just,
don't even know you can negotiate contracts.
oh yeah, you think you have
Right,
to take
sure.
them. I'm like, hold on, wait, no, red line.
Uh-huh.
This is what I want. Nope. And you just red line it, just like I was grading a paper.
Right.
This is not what I want. This is not what I'm going to agree to. And and so when it comes to data and housing and sharing data, you've got to have a sharing agreement. You have to have a confidentiality agreement. You've got to have terms of use in there. You've got to have a process of governance even around the entire database.
Mm.
And if you don't do that, then somebody's going to sit there and say, oh, well, you don't have this in place. And if you don't have this in place, then we're going to slip this in. So then you get screwed. I mean,
Right.
you give somebody your data and let's say they don't acknowledge you in a paper because they use your data, and if you didn't
Oh,
have
I
that
got you. Right.
quite written in there, because that's our credibility. I mean, number one, you recognize the patients who donated to that database, and one of the reasons why we want the day, this FDA and NORD put this program together, the National Organization of Rare Disorders, is to put it in the hands of the patients, because we don't have ulterior motives to hang on to data and databases, whether it be academic institutions or pharmaceutical companies, even though we need them.
Right.
We're not going to hang on to it and wait for the other guy down at, say, in California to publish their paper before I publish mine. So we're just going to have a P match, or whatever you want to call it. And we're going to see who publishes first and hang on to the data for 7 years. Well, my kid doesn't have 7 years.
Right.
And so I'm just on a rampage, and I don't sugarcoat either. And no one, these big PhDs or whatever, I don't care if you got a Nobel Prize. I have a Nobel Prize in motherhood, and I will just, I don't care. I don't care how many letters you got behind your name.
Yeah. Well, you need to question things, right?
That brings me to my final question before we let you go. How is Beckett today?
He is doing well. He's 13 years old. He is gone from that cute little high-pitched voice to now hi. He's
a man.
He's a man. He's a man. And I'm like thinking, oh my gosh, child. And that's another thing is parents, you guys, I know if you're listening that have special needs kids and they don't know any better. But it's a challenge when they like to strip off all their clothes as a teenager and want to go naked, because that's what they've done all their lives, So just lock up the doors, and try to get them the Fruit of the Looms on, because that's happening. That's happening. But anyway, funny. That's my life. But he's doing good. He was actually a year ago just diagnosed with a second type of seizure. Which is par for course for the disorder. We're just now learning what the diagnosis of or what the picture of this disease does through lifetime. The oldest patient in the United States is 65. In fact, there is a little movie out, another organization that's on the West Coast that also does research on SYNGAP1 did a film, and they sponsored a film to be done on her. It's Karen. It's called Karen. I can shoot y'all
I'd love to show
that. Yeah. And the oldest patient in the UK that was identified is 7. I think he's 78 now.
Wow.
But Beckett is, he's going through puberty, which is a challenge. We've started him on unfortunately, we have a cocktail of a medication. So we started a second epileptic drug, but he's still progressing because we used what we call an off-label medication.
Oh.
I won't name the drug. It's a blood pressure medicine that ended up, it was a last resort to get him to calm down. And so we have our scientists at Scripps right now looking at that particular molecule and what's doing in the brain, because about a third of our patients actually do well on it. But he is stable. He's learning. He's still learning, which is promising. Even though he's still behind, he's cognitively about a 6-year-old, 7-year-old. Verbally still.
Is that medicine a vasodilator by any chance?
I am not sure.
Just curious. It had something to do with like the flow of the blood into the brain.
I will say that it's got an indication for ADHD. It's the only one of the only non-stimulants for ADHD.
Oh, okay.
And it's a blood pressure medication. And what else? I forgot what else. I forgot.
Sorry, I threw you off track there.
No, that's okay. No, well, it's treated for pain. So they use this. I'll say it. Okay, it's clonidine, and so they use the patch for people that have really high pain.
Okay.
Like you touch their skin, it's like burning. So they use that patch to normalize their pain, so they can tolerate their pain, like an opioid like opioid addicts that have low pain thresholds. They use that. In our children, it works totally opposite. And so we're trying to find the mechanism of that molecule and how it works in the SYNGAP1 patients.
Gotcha. Thank
And
you.
so if we find a new mechanism, then we might even, because it's for ADHD, because he pays attention now and he's learning.
Mm. Oh, good.
So
Wow,
maybe we
that's
have a
great.
link to ADHD with this protein. We don't know until we
Mhm.
check it. So,
You
but
got,
he's doing well.
We've got a question from B
Sure.
Holly 281. How do you pay for everything?
We are a nonprofit. We, of course, accept donations. We actually
So what's the name of the website that people need to go to?
we have rebranded to the SYNGAP One Foundation. So if you go to www.syngap1 with the number one, SYNGAP number one foundation.org. That is the website. And we take donations. We do, of course, we write grants. We do fundraisers. We did have a motorcycle run in June for our awareness month is in June.
Our kinds
Our
of people?
International Awareness Month. We did. We had fun. I got to ride a motorcycle for the first time in like 30 something years. And
Wow.
it was fun.
Awesome.
I love it. And I got to go buy some new leather stuff too. So that was so that was always a plus. But we do grants. We have partnerships with pharmaceutical companies now that are working on this particular gene mutation that provide funding for our meetings and things like that. But most of our funding comes from the public. And so I guess throw us out there. It's been hard.
Yeah.
We just put it in the chat over here, syngap1foundation.org. Everybody needs to check that out.
And we're taking cryptocurrency too now.
Oh, cool.
Very cool.
Yeah, you want to donate crypto? I'll have to dig up the link on that one. We haven't put it on our website yet.
There you
But
go.
we're taking crypto through Coinbase.
Some Dogecoin there from Elon.
Yeah. So yeah.
Dogecoin, you said. Hey, I'll tell you what. If somebody would have donated a bunch of that a few years ago, you guys would be in good shape right now.
I know.
Right,
Well,
right.
I'm playing I'm playing some of my cards on some of the coinage right now.
It looks like it's heading back up in the right direction.
Yeah, it has been. Yeah. So there are a couple I'm looking for. I know that they got that lawsuit, going on in the Supreme Court for the SEC.
Yeah, right.
I'm looking for that one. And but we also have a brokerage account, and we also take stock donations.
Oh, very cool.
So we have different ways you can contribute. We have 4 centers of excellence: Texas Children's, Baylor College of Medicine, Kennedy Krieger, Johns Hopkins. Actually, I should say 5, but they don't call it a center of excellence in Europe. But it's a SYNGAP One clinic because they're particular about their names, the labels we call our clinics over there. But
they don't call it excellence.
they just call it the SYNGAP One clinic. They have rules at the end. I think it's the NEC. Oh gosh.
They don't want it to sound like "Make America Great Again."
Can't have any of that.
But we work with the University of Edinburgh in Scotland, the University of Miami. We're actually we designed the very first gut study in autism with SYNGAP One at the University of Miami, and Joe DiMaggio Hospital is going to be doing the neurological part, and Atrium Healthcare in North Carolina will be seeing the patients, and our scientist at University of Miami is going to be doing the translation between our zebrafish model and the humans. And the recipe they came up with started from my 7th grade digestion lab. And that was kind of unique. And we made Smurf cakes. And so they digest, blue dye doesn't digest. So it'll turn your food blue or green or whatever color. Depends on how much you eat.
We'll do that next week on the show.
We're doing our motility study. Maybe I should send you out. Y'all can be controls. I'll send you some Smurf cakes.
Perfect.
And a Texas pecan pie.
Now we're talking.
From good company, they're good. But yeah. So and then Stanford with Stanford Children's Health, and we're looking at other partnerships we haven't announced yet that we're kind of keeping under our hat until the right time, and we're hoping that what we have going on brewing with our data is hopefully a clinical trial within the next 3 years. I'm hoping, fingers crossed, if we can get there, if we can get everything put in place the way we need to, and of course, funding is the challenge.
Sure.
So,
Sure.
but I so appreciate you guys letting me chat, man. I could see I talked your ear off almost how many hours?
Oh, it was great. Time flies by when you're having fun.
That's right.
So thank you for coming on and spreading the word about your
Well, thank you.
foundation. I'm sure a lot of folks in our audience are going to be interested in helping the children. So thank you for all the hard work that you put in, and thank you so much for joining us.
You guys are awesome, and I hope to meet you guys in person. And I might drop in on you next time.
Sounds awesome.
We'll have to work
It's a
on
good
it.
time.
Did we lose her unintentionally?
I don't know what happened.
We
All
lost
of a
that
sudden, did we?
Skype. The overlords had it with us.
We didn't disconnect you.
No.
We did not kick you off.
No. She was
She
fun. What a
also
fun guest.
froze.
What's that?
She also froze just
Did she?
before. It looks like she's gone now.
Yeah.
Maybe she hit it or something by accident.
Yeah, no,
There we go.
it was meant to be. It was meant to be. Chris, you might want to just text her and tell her what happened.
Yeah.
For those of us just tuning in, you're listening to Mike G in the Morning with The Law Matters, only on the Freedom Station, WFYL. It seems to be a common theme of something I've been hearing over and over again. It's good to have her on. If you go back to the beginning of the program, at the top of the chat, Jason Stack from Stack's Farmstead typed in a little blurb about his child, Hope, being born on August, I don't know if it was 30th or 31st. My chat will not go all the way back because
I'll see if I
you
can
folks
grab
have
it.
typed so much in since the beginning of the program.
I'll see if I can grab it.
Great. This is what we love. We love keeping it going. Russ, can you see the top of the chat by any chance?
Yeah.
Okay, so go to the top of the chat. There should be a comment from Stack's Farmstead towards the beginning.
I don't see that actually. I joined the chat at 17 after 7.
Oh, maybe that's the problem.
Yeah, I don't think mine goes back that far because I wasn't there.
Is anybody able to see the chat from the very beginning? Because Stack's Farmstead, maybe.
I don't
Russ,
know.
maybe there's a video out about what's taking place over there with his new child. Maybe we can share that over the air because I want everybody to helping Hope.
I'm just texting her here to let her know. Yeah, she was fun. What a
Russ,
great
I put
guest.
it in the chat. I put this video in the chat. I don't know if you can pull this up.
In which chat?
Oh, Durso was able to find it. Thanks, Durso. Says,
Right.
This is what I see. Stack's Farmstead. My daughter was just born 8/31/21 with hypoplastic left heart syndrome. We're just beginning to learn how messed up the healthcare/billing is.
I remember
Russ.
seeing that. I'm wondering if my chat just doesn't go back that far.
Yeah, mine's not going back that
Maybe
No.
it
far.
goes back
Maybe
an
there's a
hour.
limit.
Hypoplastic heart syndrome. Russ, do you see that link that I put into the chat?
You want me to click it? Are we gonna get
Yeah, if we
demonetized?
could. Is there a way for us to watch that?
Yeah, I think I can just. Click it.
For anybody
guys
who's
won't be able to
unaware,
see
we
it.
are dealing with some extraordinary circumstances. Want to thank Russ for pivoting at the last
Yeah.
minute. A lot of us are aware of how flooded out the greater Philadelphia area has been, and our
crazy.
studio is majorly affected and is currently unusable as a result. And Russ has really had to improvise and
Yeah.
play it by ear and make all of this happen. So, got to give him credit, along with really the entire crew, Liberty, Chris. I don't take any, no credit for Mike G though.
Well, you
Well,
did
we got
99% of the work, actually.
We got
Mike.
everything up and running. Had to run various tests and things of
Mhm.
that nature.
Yeah, good job, Ross.
Thanks.
Keeping us on the air, brother.
Yeah.
Hypoplastic.
All right, I'm just moving some things around.
Yeah,
What's the video we're going to play, Mike?
This is from Jason Stack from Stack's Farmstead about his daughter, who
Oh,
was just
okay.
born on the 31st.
Oh, okay.
Yeah, let's give that a shot, Russ.
Yeah.
All right, you guys won't be able to see it the way that I'm presenting it. I haven't implemented that, but everyone
hear
else
it?
will be able to see it. Yeah, you'll be able.
Can we-
You should be able to
Okay,
hear
good.
it.
All right. Sounds good. Go ahead.
All right, let's do this. Come on, you can do it.
On August 31st, 2021, we had a daughter named Hope. She was born with hypoplastic left heart syndrome. It means the left side of her heart doesn't function as well as it should. She's going to need 3 surgeries before the age of 4 to straighten it out. We're asking for donations if anything possible. You know, we would greatly appreciate it. The medical bills are going to be outstanding. We have a family. She has 2 brothers, and it's going to be a long time before they even get to see each other. She's going to be in the hospital for some time. We're about an hour from the hospital as it is, and you know, the travel time and all that stuff. So if anybody wants to help, I'm going to put a GoFundMe link in the description. Just please send what you can. Thank you.
Wow.
Breaks my heart, man.
Mm-hmm.
That's a tough one.
Yeah, hang in there.
And we're all gonna keep that family in prayer. And if anybody can give them, even, you know, if everybody just, if you can't give a bunch, give a buck. Everybody can give a buck, right?
Everything counts, yeah.
If a bunch of people give a buck, then it's better than nothing.
Mm-hmm.
Man, it's rough. And we found out recently, Chris, I think I was telling you about it, that family, one of our neighbors, their child has a very rare condition, life-shortening condition.
Oh,
and they made a
sorry to hear.
documentary about this condition and this kid.
Mm.
And he's a kid that you see all the time and had no idea.
Hmm.
Yeah. It's sad.
No, it is sad, and it seems like it's on the rise. You know, it seems like there's more issues than there used to be with birth defects and other autoimmune diseases and problems. Yeah, for whatever reason. So maybe all the chemicals in our food and whatever's going on. I don't know, but it's sad. Yeah, being a parent, I'm very lucky, fortunate, you know, to have kids that don't have issues. Yeah.
Was that ever a concern of yours when they were growing up?
It was actually, yeah. I mean, I almost said something when Monica was on. I haven't talked about this really on the air before. I think I've told you a little bit about it, but I was born with a rare disorder and had some major health issues as a child. And my parents got a lot of help through the March of Dimes. So there's some really good organizations out there that can help people. And, you know, I'm lucky because I'm mostly normal now. Definitely not normal, but, you know, but I, you know, I think I've told you about it a little bit off the air. I had braces on my legs for like the first year of my life and had to wear shoes and got a lot of help and, you know, was bullied and stuff. And I wanted to say something to Monica, and maybe if she listens later, but, you know, if it wasn't for my mother who followed the doctor's orders and, you know, my parents who did a lot for me, like she's doing for her son, I don't know that I would have ended up doing that well. But yeah, it was a concern. We did genetic testing right before my son was born to find out if he was going to have any of the same challenges. And luckily, you know, he doesn't. But yeah, but it's pretty common, I guess. Yeah. So.
What was that like growing? You said you got bullied growing up?
Yeah, kids were nasty. They were mean. Yeah, I had the
They still
special
are.
shoes and walked funny and stuff, and had some trouble there. My early years, and kids picked on me. I got beat up a bunch of times. So, but it made me tougher in the long run. I think I don't like bullies and don't put up with that nonsense and try to stand up for other people when they're getting bullied. And if I can, whatever. So yeah, yeah, not
Wow.
good. Yeah.
Until what age do you think you got bullied?
Um,
2 weeks ago?
actually, yeah, yeah.
Till he
yeah,
was
it still
big
happens
enough
all
that
the
they
time.
didn't want to
Yeah.
mess with him.
Right. No, it
It
still
hasn't-
happens, but
It hasn't happened in at least a month.
it's more my looks now. Hey, you funny looking guy.
Hey,
I
Santa
think right around
Claus.
actually kind of changed when I moved from Boston to New Hampshire in 5th grade, and I kind of decided to start standing up for myself a little bit more. Maybe going through the transition to a new place.
Hmm.
Yeah, gave me a chance to start over a little bit. But no, kids were mean, man. Kids can be mean.
What do you
Yeah.
say to those kids?
Um,
Do you think that our parents partially responsible? Because
I've thought a lot about this over the years. I think maybe there's something in our nature as humans to maybe, and you look at the animal kingdom too, where tend to attack, the weak link, if you will. Maybe it's like a old survival instinct or something. But yeah, maybe some of it's parenting too. I think kids are better now. I think the bullying programs that are out there now, like when I was a kid, I don't think they existed the same way. And
it's
not all
weird
kids were
because
like that.
that also
not all
happens
kids.
to bigger kids too, though. That
Yeah.
Somebody always wants to fight them to prove something.
Right.
Don't you think?
Yeah, definitely. Yeah, that's true. Yeah.
So it's almost like you got to be middle of the pack and sort of blend in.
Right. Yeah, and then I tried. Yeah, I guess I was better at blending in as I got older.
I think
so that's a good point too.
I think times have changed quite a bit because nobody likes it when you make fun of crippled people or fat people anymore.
Right.
Everybody just finds their
Yeah. It's like,
their rocks and they stand up for the kid who's being picked on.
yeah.
Did you deal with bullying in school, Russ?
No, I was really tall, so
okay.
nobody.
That can have an adverse effect too. Like I was saying to Chris, that sometimes when you're the biggest guy in the class, there's certain people who think they can prove
Sure.
something by
Mhm.
trying to fight you.
Right.
Well, I mean, if anybody said, "Oh, hey, how's the weather up there?" I'd be like, "It's raining."
Mm.
Yeah. Well, no, that's not even what I mean. What I mean is to start a physical fight.
Right.
Oh no, nobody ever started a physical fight with me. My arms are also, I mean, they're not what they used to be, but my arms were also pretty huge.
You do
They're
have
not
unusually
exactly
large arms.
sticks.
Yeah.
They're not exactly sticks. Okay, they're not tree trunks, but they're not twigs either.
Yeah.
So
No, you're a big guy.
So
You saw him
nobody-
hitting that bell with the hammer.
That was pretty good. Yeah, I like that. It
Yeah.
was an explosion.
Yeah, nobody wanted that over their heads. So
Yeah.
What about Liberty? Liberty, were you ever bullied?
Liberty was
Well,
the bully.
yeah, in my school it was very cliquey in the school I was raised in, and I think girls are sometimes they do strange bullying, because it's kind of like, they like it's like kind of undercut kind of bullying, but I did deal with some stuff like more like some acne type of stuff, so I did deal with that in my earlier years, and I wound up taking Accutane, which is a very serious drug, and just because of how severe it affected me, so I was willing to take that drug that has some serious side effects. So, but that's how much it affects you when you're younger, that you want to do something about it. So, but I also want to say really quick to Stack's Farmstead that I think, Mike, you had shown me the video of your neighbor, and they had garnered attention across the world. They used all the media. See, this is when social media is good. They used all the outlets, Instagram, even TikTok. TikTok was a big one. They got like over 1 million views on this. And it looked like they hired a production company, and they didn't get there overnight. Right. But they just gained attention. They used that one app where you can pay celebrities, I think.
Cameo.
Oh yeah, Cameo. So just definitely just pump it out there. And if people don't have money, just encourage them to donate, because I did see that the mother shared on TikTok and said, listen, if you don't have money, share. Of course, you need the money,
Right.
but just share, because you just never know if you come across somebody who, can really put some big funds in there. And it did look like they had some pretty big donations. So just keep putting it out there, and every share counts,
Yeah.
DG says girls in middle school are terrible. And I can absolutely agree with that. I was friends with almost exclusively girls, and they are really mean to each other. Not in a physical
mean.
way. Okay.
Mean
they're never
girls
gonna
is
they're
a
never
real
gonna like
thing.
punch them. They're never gonna punch each other in the face like us like us cavemen guys would. They're not gonna make fun of each other's appearance. But they're gonna do stuff that's like devious and behind the scenes.
Right.
And they'll spread like seeds of doubt and stuff like that.
Yes.
It's terrible.
What?
It's terrible.
How many girlfriends did you have, Russ?
No, I agree with you on that one.
Russ is like Gator in what's that movie? The Other Guys. Remember Gator, Will Ferrell's character?
Oh yeah, I love Will Ferrell. He's great.
These girls are like my sisters.
Right. That's funny stuff.
Yeah.
Yeah.
So why were you friends with mostly girls, Russ?
Do I really have to say that? Do I have to tell you this?
Yeah. Why did you have mostly female friends?
Well, mostly for the reasons I listed, because guys are more likely to punch each other in the face and make fun of appearance and stuff like that. And,
so you enjoyed the company of the diabolical individuals who would,
yes,
who would ruin your life in more unconventional manners.
There we go.
Yes, and I learned to keep my distance from the ones I knew that were bad.
Jeremy Miller says, my son who has auditory processing disorder got it from me. I never realized how complex genetics can be. I have it because I was deaf until I was 2. And in one generation was handed down to my son. It's like watching a video where the audio timing is delayed, but in real life, that would drive me nuts.
Oh yeah, that would be crazy. That'd be hard to.
I can't stand when I see something that's off by a millisecond on television.
Yeah.
And sometimes it'll happen if you're watching cable. You ever see that?
Happens too much. Yeah. Some of the boxes have a audio delay. I don't know if you've ever adjusted that where you can fix it.
Oh no, really?
Yeah, you can go in because that drives me nuts too. I know exactly what you're talking about. Yeah.
I know
some stereo equipment and some of the cable boxes and the TVs will have a delay. It's like a sync, like an audio sync, just for that
really.
reason. Yeah.
I'm gonna have you over to.
Yeah. Next time I'm over, we'll figure it out.
Yeah, I've run into that too, and it's mostly like with cartoons, with watching cartoons. There's a certain amount that you can get away with, but there's other points where it gets real bad. And for something like if a movie is out of sync, it'll start off fine, it'll get a little bit worse, and then by the end, nothing matches at all. It's off by like 10 seconds. It's terrible. Yeah,
it just progressively gets worse.
Yeah, because it's off by so much, and it turns out that it has to do with how much data can be
the video versus the audio processor
by the audio processor.
Yeah.
Did anybody ever hear? This is totally off topic. Not really totally off topic, but
how Mike G got stuffed in the locker.
So, did anybody ever hear that if you watch The Wizard of Oz, you can sync it up with Dark Side of the Moon?
Oh
or
yes,
like
yes,
that?
yes. I've done that a little bit. I've tried.
Oh, you have?
Yeah, I have a little bit. Yeah, it's pretty
really?
cool. Yeah.
Does it work?
Yeah, there's some videos on YouTube where they do it for you. I think.
Oh,
yeah, it's already done. Yeah, it's kind of interesting. Yeah, it's pretty cool.
Dark Side of the
Especially
Moon?
if you're a Pink Floyd fan. Yes, which I am.
Oh.
Love Roger Waters.
I'm typing it in now. Dark Side of the Moon.
Yeah, it should be on YouTube.
Wizard of Oz.
Yeah.
You know, one thing that I realized that I stopped caring about is us getting demonetized. We're not even monetized to begin with.
Yeah, that should be it. Yeah, it's pretty cool.
And I don't think we ever will be.
I think a lot of people, watch it and take the CBD there.
The CBD. It's not the same though.
The non-CBD. The THC.
See, there's CBD with No THC. In
That's
it.
right. Yeah,
It's-
that's what she
it's-
was talking about.
Is the distinction the male versus the female plant? Is that the way it is?
I think there's some difference there, but I believe the cannabinoids, cannabinoids, I think it's called, can be found in both plants, and then they distill it in a way that the THC is removed, and you get the rest of it. That's my understanding, but I'm not an expert on it.
Marijuana's bad.
Okay.
Drugs
There
are
is
bad.
a lot
You
of
shouldn't do
history around
drugs.
why they made hemp illegal. I think that's why they started going after the THC, the regular marijuana plants, because hemp was such a great product, and the
Was putting
technology they used to have like
other
hemp concrete.
business was it putting other businesses out?
Yeah, it was reducing profitability for a lot of the barons in the industry back then because it was such a good product. Yeah,
Wow.
yeah. But it seems like it's coming back. So
So what do they use
like
it for?
hemp
Clothing
paper,
and stuff?
hemp paper, clothing. There was hemp concrete. It's structurally better than most other products, and it's a
Really?
renewable.
And with Trump's
crop,
farm bill now able to use it, right?
I think so. Yeah, yeah. He made some changes. Yeah. I don't know all the specifics, but yeah, it's coming back
Yeah, I
around.
believe
which is
it's
good.
with the farm bill is where that was taken off of.
Rita's
Schultz.
mentioning something there. Thanks, Rita. Yeah, that's my understanding of it. Maybe we should look into it for a future episode. But oftentimes a lot of these things are made illegal or held up just for the profitability of other companies.
Hey guys, I got
Repress technology, basically.
I got a thing I want to play. You ready?
Yeah, what is it, Russ?
Hang on. Give me a second.
I did put a couple of videos in the doc too. I don't know if you want to check them out or not.
I don't have access to the doc. Hang on. Yeah, you guys can't see it. It's a clip
No.
from King of the Hill.
Sign a petition to legalize hemp.
What's hemp?
It's a cheap and durable source of fibers that can be used for making clothing, rope, and paper.
Typical government overregulation. Why wouldn't they legalize this stuff?
Well, because, it's basically marijuana.
Ah!
Whoa!
That's
But
great.
it's not though, right?
No, it's not. It's different.
Yeah.
That's just the plant itself, I believe.
Is that
the
is that
fibers from
government
the plant.
misinformation to?
I don't know, Mike. It's a cartoon. I thought it was funny.
No,
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 he's
no.
talking about
There, I'm saying, has that been perpetuated over time
hmm
for a specific reason?
I've seen some documentaries about it. And it's interesting because when you look at the old, ads about marijuana and how it would make you crazy and you lose your brain,
Like that wacky
even,
tobacco.
yeah, right, yeah, exactly. Like even during the Reagan era, I remember as a kid seeing, them cracking eggs in a frying pan and be like, "This is your brain. This is your brain on drugs."
This is your brain on drugs. That
And I was
scares me, that
afraid
one.
to touch the stuff, growing up watching all that, and it's pretty effective marketing, but they really went after it in a way that now we're learning isn't true, and there are a lot of medicinal benefits.
Are
and
you
especially
telling me
those
it's not
kids,
bad?
Yep, the epilepsy stuff. So,
Are you trying
but
to
yeah,
tell
that's
me
our
it's not
government,
bad?
overreach
Okay.
and looking out for profit over benefits to
Yeah.
citizens, which I think we're seeing a lot of now with the COVID stuff, in my opinion. Similar, we'll
Yeah,
probably.
I think if anybody has like somebody with like chronic pain in their life or anything like that,
Sure.
I mean,
hmm
sometimes people get so desperate, and it's like if you were going to go to opioids versus that, I mean, that's the arguments that I can see.
How could it be worse than the opioids?
No,
right?
it's not.
Yeah, the opioids.
right.
I mean, for real, it's a crisis, and
Yeah.
but and then even the arguments that you can't really argue with is that versus alcohol too.
Sure,
I mean,
sure.
I
Yeah.
mean, liver damage and things that
Yeah, I mean,
happen.
if
with
anything, marijuana is way safer than alcohol and tobacco.
Yeah.
Nobody's ever overdosed on it.
Right.
Generally people don't fight when they're high on marijuana. They're usually pretty relaxed.
No,
and-
they're usually
Calm,
like Shaggy from Scooby Doo. Instead of on beer where you're like, "Hey man, fight me," they're like, "Hey man, do you have a sandwich? Can I have a bite?"
right.
You
No, I could see
You
how
want to see my
driving
talking
impairs-
dog?
Well, that's
Yeah,
definitely
driving.
a concern, sure.
Yeah.
Right.
Yeah. And I think
See,
alcohol impairs you more.
Durso said reefer madness.
Right,
That's
right.
what they called it. That's right.
Yeah,
Right.
reefer madness.
Reefer
Yeah.
madness.
Yeah.
I just get annoyed when somebody's trying to tell somebody in their family what they're dealing with, what to do or not do.
It's a shame that YouTube doesn't care that the station pays for the licensing to play songs, because I would love to play "Don't Step on the Grass, Sam" by Steppenwolf. If you don't know that song, I think you ought to check it out. "Don't Step on the Grass, Sam" by Steppenwolf. It's a really political song that they put out about the government overreaching and regulating the marijuana and the war on drugs and
I hate the
everything like that.
government. They should
Let's
all
play it, Ross. Let's play it.
I hate the government. They should all be fired to the moon.
I wonder if that. Yeah, I guess that song would come up as copyright, even though it's older.
But aren't we allowed to play things as a radio station?
As a radio station, yes, but YouTube doesn't recognize that.
Okay.
Also, we're using the Mike G channel, so
Russ knows the ins and outs. Huh.
So according to the Google, or at least just anything in general, Mike G isn't the radio station.
Right, I got you.
Oh, that's true.
Yeah,
separate
thing. True. Maybe we could get some kind of a rogue platform where we can have.
What about Rumble?
Would Rumble care?
Because we're on Rumble too.
Yeah, would Rumble care, Russ?
I don't know if Rumble would care.
We should try it sometime where we tell everybody, hey, meet us at Rumble. It's the underground. The underground party.
That's right.
Well, so
we're going to be playing music and all.
Right.
Well, the thing is with Rumble, they are slowly moving towards having the free live streaming. Right now, it's locked behind. I believe their lowest tier that you can get it is the $25 a month, and DG says Russ not as much as I do. Oh no, I'm challenging you, DG. I hate the government more.
Russ really does.
I don't know.
They should all be fired into the
Russ,
sun.
Russ, you can't have him say anything without something with the government coming in. That how much he hates it. I mean, he really.
I hate the government. I hate big tech.
We should ask them. There should be criteria. We ask them each 100 questions
highly
about their
disliked.
hatred for the government.
There shouldn't
and see
be
who
any
comes
government.
Out, who scores more points?
There shouldn't be any government. Every government official is going to get a 0 out of 10 from me.
No government.
I mean,
Nope.
Russ doesn't like it so much that I mean, Russ.
Because I understand that people don't like government overreach, but let's talk about what that would be if there were no government, right?
It'd be called anarchy.
So there's no speed limits, right? You can drive however fast you want. You ever see those maniacs on the road? You're like, what is wrong with this guy? That's okay. Perfectly fine.
Right.
Unless somebody else is going to enforce it.
There's people who would literally run you off the road.
Oh yeah, well the Skookle's like that. I don't think I've ever seen anyone get pulled over in the Skookle.
Like,
it is the Autobahn. It's the local Autobahn.
The South Shore of Staten Island. The South Shore of Staten Island is already no government.
Guys.
The Long Island Expressway is regulated from traffic. You know, that's the largest.
I actually think that the firearms laws in New Jersey came from the road rage drivers. Like if everybody could carry in New Jersey.
Maybe.
It's out of control.
Yeah, maybe.
DG says, I'm older, I win. Yeah, darn right you are, DG. You old fart. You old windbag.
Here we go again.
It's only gotten so much better.
Is your cane full of wind too?
Biden's making America great again, right?
Sorry, I don't
making
want to...
America good again.
Yeah, right.
Yeah,
making America good again.
Making the
I was very
Taliban great
disappointed
again, maybe.
that video did not take off, and that not even our subscribers. I think that video had to have been suppressed.
Which one?
The "Make America Good Again" video that we put out.
What are you surprised?
These things
should we get you checked? If you're surprised, then we should get you
Hey,
checked.
Okay. Where should I go? I'll go now.
I don't know.
I feel ridiculous for even saying so.
You are ridiculous. There's a good reason for it. DG
take
says,
advantage of some of those
ask
red flag
Rich
laws.
how
We'll
much
get
I
to
hate the
302,
government. How much do you hate the government, DG? What should be the penalty for being part of the government?
What else? What? No. Harming, robbing.
If there was no laws, you're saying?
Oh.
I'm not saying there should be no laws. I'm saying there should be no government.
I mean,
I like Jeremy says, I don't want to abolish government. I simply want to reduce it to the size where I can drag it into the bathroom and drown it in the bathtub.
That sounds good.
That's
I like that. Yeah.
What's the
It's certainly out of
difference?
control. Certainly out of control. I just got a Amber Alert just popped up on my computer here.
Oh, has somebody kidnapped the government?
78-year-old white male wandering around D.C. He thinks he's the president, apparently.
It's a silver alert.
Silver alert, Billy.
Oh, is that a silver alert?
Oh,
Oh, you're
man.
right. I'm sorry.
Think of
No,
silver
he's
hair.
Yeah,
he's
that's
just a
right.
gray nomad.
I messed my own joke up.
That was funny. But at first, when you said
Oh.
Amber and you still had a little smirk, I don't think he knows what Amber Alert is.
Like somebody kidnapped a child. That's
Right,
serious.
right.
Don't mess around.
Well, mentally he
Russ
is a
just got
child,
kidnapped.
so mentally he's
Goodness
devolved
gracious.
into a child, not knowing
Silver.
where his mommy is.
I
And
need a
so
silver
he's-
alert
he's
for
wal-
myself.
He's wandering around
A silver
Walmart.
alert for Rogue talk show radio host.
Yeah.
Oh my goodness.
Yeah, what a crazy week here, huh?
Oh,
Afghanistan,
gosh.
all that, yeah.
So, what other drawbacks of no government whatsoever?
Fights could just happen.
Well, I suppose who's going to pave the roads and take care of, the services?
They always say
and-
that. though.
Nobody
That
paves
guy-
the
I
roads
like
in the
hearing that because
city.
that's what they always say. They're always like, but the roads. But the roads.
Well, guess
Well,
what?
they're
Grow
really
a
not
pair
very
and
careful
drive
about
on
it
some
anyway.
dirt.
A good pothole will make you rethink that.
What about things like we've been talking about pharmaceuticals, how we can't stand pharmaceutical companies, right? But somebody's
they
got
all
to make
suck.
medicine. If you've got no government whatsoever, where is the control of that? Not to say that we've got a great system to control that to begin with. I'm not saying
Yep.
that at all. But what happens? They send out.
Then you go to
No.
communist Canada if you want health care.
How would that work though? How would that work if you've got?
Use your
Because as it is,
legs.
you could say what the argument could be that if somebody puts out a bad product, they're going to be held liable, they're going to be sued, and they'll be sued out of existence. That already happens now, even with the controls that are.
Not
So I
quickly
guess that's
enough.
part of the reason why people say that if they're getting through anyhow, then what's the point of having the regulation? I don't know.
Well, in a lot of ways, if we look at Afghanistan right now, there's no centralized government. It's very tribal. So I think that, you need something, you need some structure that everybody agrees with that's just not out of hand, out of control, smaller, like we just talked about a few minutes ago, where you could drown them in the bathroom, But yeah, I think that's the challenge we have is it's just gotten too big and too regulated and worrying more about the corporations than the people, it seems like now.
Mm. Why is that? Convenience? Nobody wants to live too far from a commercial coffee shop, or
It's a part of it, I think. Yeah.
There's a
They become
Wawa
pretty-
and a bank
pretty
on
weak.
every street corner.
Yeah.
Tell me more about
You know what?
inconvenience.
have you ever tried to buy nothing but American for a period of time?
That's almost
No, because
impossible
it's
now.
impossible.
No, have you ever
Yeah.
tried? Have you ever tried though?
Did you know that Made in the USA is just a marketing campaign?
Well,
I'm serious.
well-
I got some of those compressed air things to clean my computer out, and it
Yeah.
had a sticker on it, "Made in the USA." So I'm like, "Oh, okay." Flip over the can, "Made in China."
Really?
Yeah.
well, I want to say something quick about that. Was
Well,
I
they
used to
shouldn't be
work for
labeled
an
that way
eye.
then, yeah.
I used to work for an eyeglass shop, and there's like some kind of rule where if like a certain percentage of the eyewear was made in America, they can say made in the USA. But if like this certain percentage was made in a different place, you can say made over there. So it's like a percentage wise,
Mostly peaceful protests, mostly made in the USA.
Yeah.
Mostly
Right,
made
right,
in
And
the
then-
USA.
Or in Italy. So also a lot of people like things that were made in Italy.
This
So if
pizza's
a certain
mostly
percentage was
Italian.
made in Italy, you can say, oh, this is made in Italy, where
Hmm.
a lot of it was made in China.
Hmm.
Yeah, and like Apple does, like assembled in the U.S. They try to trick
Right.
you or something. Yeah.
I
And
mean,
DG makes a
that's
good
not
point here. In
misleading.
all
Yeah, that is a
seriousness,
good
it is
point, yeah.
humanity that is the problem, greed,
agree.
lack of God in their lives, and all about the me factor. Yeah, if we had small communities with people who had, Christian values, then perhaps you wouldn't have to
Right.
worry
So
about
wait.
where's the government to watch
Yeah.
that they're not poisoning us,
Yeah.
or they're not, screwing everything up as far as
Mhm.
somebody brought that up to my attention recently, like the Department of Weights and Measures, for example, to make sure, something like that. Could you think about how badly, if corners are cut for certain things,
Sure.
like houses could collapse and buildings could collapse? I'm not saying that the government's the answer,
Hey,
but
that building
people
in
will do
Miami
messed up
collapsed.
things to
That
save a
building
few
in Miami
bucks, right?
collapsed a few months
Right.
back, right? Yeah,
Right. People do messed
Build
up
your own
things
house.
to save to make a few bucks, right?
exactly. That's what it comes down to. Yeah,
The
yeah. We're
sol-
like morally bankrupt as a nation.
the solution here is do it yourself, basically. If there's a pothole in the road, fill it in. Buy the cement, mix it up, fill it in, put some cones around it. If you
We get
got
run
a
over
problem
around here.
if you got a
Here we
problem
go.
with
Tried
the
to make a
way that
list
your
of-
house was built, tear out the walls, build it your way.
What we should do is we should all get together as the Mike G and Morning family and start to put together some kind of a running list of where you can buy things that are made in
a good
America,
idea. Yeah.
if possible,
Mostly.
even made locally. I've been even trying to find brands that
Sure,
manufacture things in Pennsylvania
that's cool.
to try to keep it in the family, so to speak.
I think
And
there's some
something I feel
websites.
really called to. I almost see the way people
Chris
on
is
the
a bit
left,
frozen.
they always want to like, and it's not about being patted on the back or anything like that. So I hope I don't come off like that. It's just something that I think is interesting and want to discuss.
Yeah,
But you ever see those people on the left who they'll buy something that's like made out of 100% sustainable materials or whatever they call it,
Right.
know? It's just that
Well, usually that
lefty
means
hippie language
cardboard.
stuff.
right,
Is it-
right.
Like this shirt is made out of recycled newspapers or something.
Great.
like that.
Thanks for making my $20 shirt out of garbage.
Yeah.
I spend how
you know,
much and it's made
they
out of
always feel real
garbage?
proud about themselves for using
Right.
that. I almost feel like, not that I'm proud of myself for doing that, but I feel like this is how we can start to make a difference, or at least put a dent in this. Is if
Yeah.
we all make it a point to. It's important to me to buy
Right.
American, or important to me to. What DG says you guys need to live where I do. What county is it? Can you at least
Where
give
are
us
you, DJ?
the county? Did you say Carbon? Did you say Carbon? And I'm just not remembering that she said that.
Looks like there's a website here, madeinamerica.com, and they just sell things that are made in
But is
America.
It's
But is that
probably
what
full
Russ
of
said is
crap.
a scam?
It's
hope
probably a
not.
scam.
It better not be. But
bet it
that's
is.
odd.
It's
Where did you buy that
confusing.
stuff, though, Russ? Did you buy it off somebody at the sidewalk, or like where'd you?
What are you talking
Because they
about?
shouldn't be putting stickers on there, you know. Where'd you
Made in
get
the
that
North
stuff?
Pole. You know what gets confusing though is like I have a family member who works in a factory who makes a material for cars, like a certain type of car. And so, if certain parts of it, like I was saying before, are made in the USA and certain are made out of the country, is it considered made in the USA?
Right.
Because I mean, who would think of that? I didn't, just growing up,
Well-
I didn't even know that there's like a glue that's made like this big factory
Yeah.
just for this glue, and this glue that's used in all different products. But
Is it Gorilla
they also
Glue?
have a factory in Switzerland, and I think I don't know if they're American, but it's very difficult to tell. And I want to say a lot of these factories, really, really hardworking people work there, so you don't want to take away from them either. But then the other side of that is the factories get so big and they're not treating their workers right. You know what I
Mhm.
mean?
Yeah.
So I get way too deep into this stuff. I don't know.
Well, the marketing folks mess things up quite a bit, Like even with all these electric cars, they say zero emissions, but that's not really true because there's a lot of emissions being created when they manufacture the cars, and then the lithium batteries later, those need to go somewhere and be
Not
recycled
only that, but
properly,
the
or
energy that has
they're
to
going to be bad
drive
for the
them.
environment, things like that. So, the marketing folks.
That's right. The marketing.
This
Yeah.
one's
Yeah.
WSI Sportswear is
very-
one that I found.
Okay.
I ordered something. I'll
Looks like Chris done froze.
Oh, I did?
Yeah.
Yeah.
I think Chris rose.
Uh-oh.
it's frozen in time.
Let me turn my camera off and on. Let me see if that helps.
Have you tried turning it off and back on?
Oh, DG says Lehigh.
Oh, here
How's
we
that?
go.
Am I good?
Lehigh County.
Lehigh. Okay, Lehigh. My
I
third
can't
eye.
think of somewhere
I was
in
wondering what that
Lehigh
was.
County that's like 100% sustainable, though. You know what I mean? Like
Yeah,
That's
I mean,
funny.
as long as Governor Wolf is
That's funny,
in
Jeremy.
charge.
What did Jeremy say?
I kind of like that.
Jeremy says
My
Philly
third eye.
Chris's perennial eye is
Right up
showing.
Oh, is the
Right.
spinny wheel?
Yeah, I turned on the spinny wheel because that Chris froze.
It's right on my forehead. My third eye.
Yeah,
That's great.
the Illuminati. That's the
My
mark of the Illuminati.
pineal gland
right?
is awake. Hey,
That's pretty good.
talked about consciousness on the show. I think it's, it's a level of consciousness we all need to get to collectively to think less about our own individual
You
needs
freeze
and
in this
greed and
world,
everything. Am I
and
freezing again?
Freeze in the spirit world, right?
I think there's a storm rolling through here right now.
Oh,
Rita says, "We the people holsters made in the USA."
Nice.
are they
I
really?
know that
though?
Next holsters are also.
We should charge people like, so you're made in the USA, huh? Get mentioned on our on our
No doubt.
radio show.
Well, there's this website. Maybe I'll reach out to them this week and see if they would like to come on and talk with us.
Yeah, I'm curious to know how they vet.
MadeInAmerica.com.
You know,
Yeah,
how
I
are
have
they
a lot of
vetting?
questions.
They have quite a few people they work with. It looks like I'm looking at their site right now. Sponsors.
BG says Western Lehigh.
Hi.
Don't get too specific. You might have
Nice.
Philly Chris showing up at your door.
That's right. Hopping my tier
You have
3B.
to put a silver alert out.
That's right. That's right. There's quite a few products on here, so it's becoming more of a thing. But
Do they have any dish soap?
Trump. What's that?
Do they have any dish soap?
Let's see. Got to get that at the dollar store for you. That's
Didn't
what I
you
can
say?
say.
Didn't you say that there's a horrible?
It was the worst thing in the world. It was so watered down. Yeah,
We were
don't ever
crying.
buy dish soap at the dollar store.
That was
It
actually
never dawned on me. Well, no pun intended.
Dawned
there.
on
that it
Never
could be
dawned. Oh.
Chris. That was actually just dishwater.
It was
It was
gone in
recycled.
seconds.
It's
didn't-
green.
I'm not
What-
sure it was even soap.
Was it green recycled dishwater?
It's probably like most of the juice you buy in the bottom corner. It said 5% real soap or something. You know,
Yeah.
like when you buy juice, it's like 5% real juice. Oh, okay, great. What's the other 95%?
Recycled BS, just like the
Apparently.
government.
Yeah.
See, that's the kind of jokes Russ makes all the time.
Hey, got
All
him.
the time.
All the time. Yeah.
Wait, what website are you on, Philly Chris?
It's MadeInAmerica.com. I'm looking at their bestsellers right
Let's
now.
see.
And they're bestsellers. Oh, I
They
gotta
got
see this.
mascara. They
Let's
got,
everybody go there on the chat.
Yeah.
Everybody go to madeinamerica.com. Let us know.
There's all kinds of stuff on here.
Hmm.
America.com.
Somebody sent me, one of my buddies is in the oil and gas industry, sent me a picture of these two college-age girls protesting the oil and gas industry,
Oh, yeah.
ban oil and gas, and they've got tattoos and makeup and
I thought
a
you were
bunch
gonna
of
say
other
they were
things that
wrestling
they
in
don't
oil.
realize
Right.
include
Yeah,
products
petroleum
that-
isn't like everything.
that come from the oil and gas industry. It's like, okay,
Oh.
you ready to give all this stuff up, or
Your sneakers, you don't want shoes?
So,
Right.
Chris, is this for wholesalers then? Because it looks like they don't actually sell the products. They're selling it
it
probably.
says
to
Liberty
stores.
bottles. I didn't
Yes,
know
I
you
was
had a
going to say
side
that.
hustle.
I saw that. Yeah.
You're leaving us out of here.
I
What
don't
is
know
it?
What
if
am I
it's
even
for,
looking at?
Catch up with the cause.
Guys, where are you
Marketplace.
finding this?
That was a good question.
MadeInAmerica.com. Is that what
I'm
you said?
there, and I'm seeing. I don't see products.
Well, if you go to, there's some
Buyers?
links there. Bestsellers, new arrivals, home, kitchen,
What?
outdoor, clothing and apparel, health and beauty.
I don't have that.
That's and no, should be
Liberty
Made in
bottles.
America
Hmm.
dot. Oh wait,
Made in
Made
America.
America
Is it .org or .com? or
dot
.net?
co/collections. It looks like.
Oh, my God. That's not the
What?
same
Well,
as
you're gonna have to- you're
.com.
gonna-
Hold on a second.
How did I get there?
Made in
This
America.
went to DuckDuckGo. I use DuckDuckGo, so it's
Dot
Made in America.
.co.
Made in
dot
America
what?
dot-
.co/collections. Okay, now I'm
yeah,
on
dot
that.
.co.
That is
Yeah,
something completely different.
I thought it
Guys.
was .com.
What's the actual website?
They have cleaning products.
MadeInAmerica.co. Try that.
.co. Isn't that like a different country?
I thought it was, so I don't
Yeah,
know.
because like
That's
.no
not
is,
actually
like, Norway, I
American.
think.
Maybe it's
Ah,
China.
This is definitely not
Not
American.
American at all.
They have American flags all over
it's
the
not
front.
even an
of the
American
site.
website.
So does a lot of the-
MadeInAmerica.co.
It says somebody from Ben Salem made a purchase that supported them 8 hours ago or something, right
Oh,
out
yeah?
of Pennsylvania. Maybe it's one of our
Okay.
listeners.
Could be.
Oh, I doubt it.
What? Oh, DJ said she'd give me soap. Who's she talking to? She says, "Give it up already." What's she talking about? Oh wait,
No
so this
idea.
is definitely not America. It's a MadeInAmerica.co. That's a different country. What
I
is
don't
that?
know.
Are you
I don't know
sure
why.
that .co? I think that's just another option.
Like
other
this,
than
It
what's
might
.com.
be another option. Yeah, I don't know.
What
Liberty
country
Tabletop.
is CO? Somebody tell me
Check out the Liberty Tabletop. I got to click on that.
that. Everybody's
I'm
been using
seeing
my
a
name
bunch of
lately.
food.
Well, I'll look into this because if they're lying, then we'll find that out and we'll oust them on the air. But I imagine it's a U.S. company selling just.
Oh,
Maybe
I think
CO stands for
okay, hold
company.
on. I think CO is assigned to Columbia, Chris. So
No way.
Yeah.
yes, I literally
No
because I know
way.
this because I go for Norway stuff all the time. And it's .no or Denmark.
Maybe
is-
they're in another country, but they're just selling Made in America stuff. It could be. Maybe
I
that's a thing.
can't.
Maybe
in
it's
other
all a
countries,
bunch
like,
of crap.
Like here, it's made in China. Over there, it's made in America.
No.
Oh,
Says
man.
CO means commercial. It's used as a second
Ah.
level domain in the domain name system used to route internet traffic. The main registers second level domains in the form of .co, XX, where XX is the country code.
I've never seen a one that was
Okay,
dot with
so
I'll look into it this week.
here's a question.
Big
How
announcement
much
next week.
how much of this radio program is made in America? Because like there's us,
Very
we're
little.
all
Yeah,
American,
Sean Durso agreed with
but
me.
all the equipment that we use.
That's what I mean. The equipment.
What's
very
the
little, yeah.
percentage?
My headphones, probably. And Mike's headphones.
Yep.
That's about it, right, Mike? They're made in New York.
What's the
Well, where are your
percentage we have to
Grados, Mike?
meet?
You haven't been wearing your Grados, I noticed.
Oh, so here's what it says. The CO domain extension is the internet country code top level domain assigned to Columbia.
Oh.
However, there are no restrictions on who can register second level .co domains, and it has become widely accepted as an international domain representing company or corporation.
Okay,
So there we
then.
have it.
Well, let me go to madeamerica.com and maybe that's already taken. Made in
Yeah,
America.
it is. That's where
It is. Well,
that's
that's
where
what
we
we're
all
looking
ended
at.
up because you gave us the wrong site.
Yeah. They have the
MadeInAmerica.com.
Liberty bottles on madeinamerica.com.
Yay.
They
Probably-
have Liberty Table.
Probably
on the
made
other
in
one.
China. In China though.
Yeah.
Everybody uses Liberty because it's like, but so this is a Columbia website that says made in the USA.
Well, it could still be based here, though.
Yeah, it
based on
doesn't-
what Mike was saying. It's
it's
just
not
the domain.
Yeah,
strictly
it
Colombian.
could be, but most likely it's not because I know I've gotten hats straight from Norway and it's .no.
I don't think the
They
web
have some
name means
nifty
anything.
patriotic socks here on the.
Oh yeah, we need some of
I,
those.
see, the thing is, I don't think
Patriot.
the web domain really means much of anything as far as
Can,
like
I, can I
the country
interest you
codes
in the
go.
sock of the month club from
'Cause-
madeinamerica.co?
Socks were really big for a
They
while.
have Mike G socks.
Because you could own something like buttloadoftechnews.com.
Made in
Buttload
America.
Tech-
store.
we got Buttload Tech News. We got to get that set up.
Oh,
Mm.
man.
Liberty,
Don't
talk to
waste
the
your
web guy
money,
about that.
Mike.
Liberty, did you talk to the web guy about getting Buttload Tech News up and running?
No.
You sound like you're not looking forward to that.
Should I?
It's
Sometimes
just-
I have
it's
to
just
be
not.
the Debbie Downer for the crew. Like, I don't know.
What?
What's the
Is it a
matter,
little
Debbie?
wild? Is it a
What's the
little
matter,
wild?
Debbie? You feeling
Well,
down right now? You a Debbie Downer?
Liberty doesn't like Buttload Tech News. We were on a streak for a while
Yeah.
where
Ah, I
anything
see
that
what
I
you
ran
did
by
there.
Liberty, and Liberty told me, please don't
Whoa,
do that.
what is this?
And we did it
What is
anyway. It
this?
became
That's
wildly
right, that's
popular
right,
on
that's
Mike G in the morning.
It's usually been successful. Yes.
Yeah. So
Now we
You
have
know.
to do it.
we're running things by her. Liberty, what do you think we'd about do this on next episode? Oh, no, don't do. You can't do that. We got to hit Billy Chris.
Listen, these guys
Winner,
need
winner.
some kind of stop sign, or they need somebody to slow them down. 'cause
Medication.
if you just let Philly Chris and Mike G run wild, this is crazy. I mean, they do anyway. I don't
That's
think
true.
I
That's
ever
true.
stop, but I think I just ignite the engine.
There's no stopping us, right, Mom?
I'm like Governor Murphy. If I say no, they're like,
No red flag laws for the show.
Governor Murphy should be fired into the sun.
See, there's one of Russ's
King
jokes that
Philip.
ends up-
There we go.
King
It's all I
Philip.
hear in my ear is Russ just.
Yeah,
Wow.
that's about
So
all
on
the
this
time
Made
we
in
have.
America website, you've got men's shoes. They've got two
Oh.
pairs of shoes.
Clothing and apparel.
One's $328,
Where
That's
is
the
it?
problem.
and one's $298.
Can you please put it in the chat, the website you guys are looking at?
He just said madeinaamerica.co.collections. I'll put the shoes.
So we're looking at a
Slash
Columbia.
collections, I think.
I still think it's a Columbia website. I think they're
Well,
selling America stuff from
Made in
Columbia.
America.
Well, good for them if they do. Right?
Let's see. I guess. I mean, I'm just
Maybe
saying
there's,
it. We're
an
looking for Made in
address or
America, but
something.
we're
So what
ordering it
else?
from Columbia.
Just join the movement. Get involved. I'm looking at their
Let's see.
About Us.
It
Made
shouldn't be
America
this
Co.
hard
is-
to buy
it's-
Made in America stuff.
It really shouldn't be.
No, you
to
shouldn't
buy it
have
from
to
another
get it from
country
what is
or
alleged-
whatever.
You gotta buy it.
Columbia.
You gotta go. So how do you buy stuff made in America? Well, first you gotta go to this website from Columbia.
Right.
Oh, yeah,
I'm looking for an
that's
address or
mind-boggling to
something
me.
in here.
So yeah, this is our factory in Asheville.
Why is it?
Carolina.
It's really tough. That was really the point that I was making by saying,
Mhm.
you know, it's been trying to make a conscious effort. It is.
Yeah.
It is tough. I found
It's impossible.
looking for just like sporting goods, not sporting goods, but sporting apparel, you know, clothes to wear in the gym and stuff like that.
Mhm. I mean, there's a lot of small businesses that are starting up.
I found out there is a company called Boathouse right in Philadelphia. Make clothing out there.
Look at this, Bearsville Soap Company.
A soap company, you said?
Yeah, it just came. I just said Made in America. And a soap company came up. Must be meant to be. We're all about soap on this show.
Yeah, this is the.
Wait, hold on. You got to go right to the About Us, and then you got to really dig. Okay, Bearsville, New York is located in the Catskill Mountains, where the landscape is rugged, the air is fresh, and the people take pleasure in rolling up their sleeves and making things happen with their own two hands.
They actually have some pretty nifty dress socks on this
Oh, yeah?
Made in America store.
The dress socks.
You're still in the Columbia store. huh?
Clothing and apparel.
You gonna wear those to the gym, Mike?
No, wear them to court.
Huh?
Oh, okay.
It's America.
I have to wear.
You don't wear wait. You don't wear a suit to the gym?
Mike
Of
always
course I
wears a
do.
suit. Everywhere he goes.
Are you kidding? My pajamas are made out of suits.
All right, I think it's bedtime.
I think so.
Anybody else have any other things to add to the good of the order? We didn't really get into Afghanistan or anything today.
Yeah.
Oh,
no, I
don't
guess
get me
everybody's
started on
probably
Afghanistan.
seen enough
Do
of
you
it
guys
and
want to
wanna
get
let
into
down next week.
Afghanistan?
We'll save it for next week. Big announcement next week.
Real, Chris, shut up.
Well, I'm going to send you a video of a guy that I might be able to get on as a guest. I'll send it to you guys later. See what you think.
I'd say we talk about it now.
We can't play it now, though. You can't play it now.
Why
I was
not?
going to play it tonight. It's in the dock, but you have no access to the dock.
So just
We
play
can't
it.
see it. Huh? It's in the
I-
dock. You can't get to the dock.
Well, can you put it in the chat?
Yeah, put it in the chat and I can just bring it up.
Okay. All right, hold
Also, DG appears to have posted a what looks to be a phone number in the chat. I think it got
Oh.
removed from YouTube.
on. Oh, really?
Yeah. I don't know where it leads. So I kind of
Oh.
don't want to show it.
You should show it.
And I
man.
don't know how to just remove it without like blocking DG, which I don't want to do.
No, don't do
What,
that.
DG?
I don't see a phone
Yes.
number.
You're not. God. It
I
was
don't see a number.
removed from YouTube chat. So it's not going to be where you can see it.
All right.
You know, sometimes I
Let's see.
feel
You
like
want
I'm
me to put that
talking
in
to
the
a wall.
thing there. So
Do it
see
live.
if this works. For
All
us.
right, we'll
We're
do
gonna
it
try to
live.
type in-
We have some nice top chatters that have hung in with us
know.
till the end.
I was watching that. Yeah,
The usuals.
it's awesome.
The Mike G in the Morning family.
MikeGinthemorning.com. See
I-
here.
Okay, DG may be high on Xanax for a while. I heard something on one of the on one of the nearby radio stations.
There, it's in the chat, Russ.
I can't remember which one it was. It was near 1180 on the dial, but I'm pretty sure they said something about Xanax. Like if you had exhibited like some kind of illness or disease, you may be entitled to compensation. One of those typical lawyer ones. So, DG, you might want to be careful.
All right, why don't you go ahead and play
right,
the video?
I put the link in there, and I was able to get the phone number for this individual, and somebody's already spoken to him, so we could get him on, I believe, if you're interested. But
what is this, Chris?
I thought it was a video, sort of like Simon Campbell, sort of like that at one of these school board meeting videos.
Oh.
Will we be able to see it, Russ?
Your
we be able to
link
see it?
hasn't come through.
Yeah, I don't see it.
I put it in the chat.
What chat?
On
Which
YouTube.
chat?
I don't see it on the YouTube
one,
chat.
I'm sorry. I'm gonna put it in here.
For God's sake, Chris.
I don't see it on the YouTube chat.
Chris, how old are you? 150?
I've been 120 years.
He's silver, okay?
All right, it's in the other
now
chat.
I see it in the Skype chat.
I put it in both places.
Chris is silver age.
Chris, okay. I'm gonna attempt
Do you want to
explain
save this though?
You want to save it? Let's save it for
it.
next time. Yeah. Let's save it.
All right.
Just remember though, because a lot goes on during the
It's
week.
in the doc already. I was prepared today.
All right.
In the
Let's
doc.
let's
I
save it
wasn't.
because
All
it's
right.
too late.
Yeah,
We're gonna
it's
be
too late
dropping
anyway,
people.
yeah.
More people. Will
We'll
probably
play it next week, and then we can decide if we want to have him on. But I think he'd be an interesting guest. I liked what he did in the meeting.
Yeah. All right. Well,
Cool.
thank you everybody
Thanks, everybody.
for being here. And great episode.
Mm-hmm.
Raise some awareness for
Yeah.
those children dealing with this rough stuff. All right, I'll play us out.
What does that mean?
Do it live.
What does that mean to play us out? That's all the time we've got for today. Stick around for We the People, The Constitution Matters. Pastor David Whitney, Professor Phil Duffy. I'll be joining as your legal analyst. We miss you, Ellie. Daddy loves you.